Bagimu alma mater, ku berjanji setia, berdharma bakti suci, berjasa mulia. Belajar untuk nusa Indonesia yang ku cinta, air langga kau hiduplah, air langga tetap kau jaya.
To all the participants, our event is about to begin. Kindly remind to stay tuned with us, and thank you very much for preparing yourself to join our event in this beautiful Saturday. For all of our students who already joined in this room, kindly remind there is a special announcement for fourth semester students. As your assignment, you have to summarize today's lecture on both viral and bacterial diseases subject. The assignment must be submitted before June 25th, 2021. And please for its class coordinator to collect and submit the assignment to the subject coordinator. Assalamualaikum warahmatullahi wabarakatuh. A very good morning to all the participants. First of all, let me introduce myself. My name is Ratih Novita Praja from Faculty of Veterinary Medicine, Universitas Airlangga, and I will be guiding the webinar as a Master of Ceremony. The Honorable Vice Dean of Faculty of Veterinary Medicine, Universitas Airlangga, Dr. Rimayanti, Doctor of Veterinary Medicine, Master of Science. The Honorable our guest lecturer, Professor Madya Dr. Maizan binti Mohammed from University Malaysia, Kelantan, Malaysia. Dr. Intan Nur Aina binti Kamaruzaman from University Malaysia, Kelantan, Malaysia. The Honorable all lecturers and all the participants of this event. First of all, let us pray and praise to Allah Subhanahu wa Ta'ala. Because of Allah bless and mercy, we can come together without any obstacle, with healthy condition in this event. I am very happy to see you here, and it is our pleasure to welcome you to our guest lecture event, which proudly organized by Microbiology Division, Faculty of Veterinary Medicine, Universitas Airlangga. This guest lecture event is a routine program as a part of the virology and bacteriology course, especially for the fourth semester student. And for today, the lecture topic is viral and bacterial diseases, which invite two experts from University Malaysia, Kelantan, Malaysia. Before we start the event, let me share the agenda of this event. We have several agendas are as follow. The first agenda is opening. The second agenda is opening remark by the head of Microbiology Division, Dr. Wiwi Tiasningsih. Doctor of Veterinary Medicine, Master of Health. The third agenda is opening speech from the first Vice Dean of Faculty of Veterinary Medicine, Universitas Airlangga, Dr. Rimayanti, Doctor of Veterinary Medicine, Master of Health. The fourth agenda is guest lecture, which delivered by our honorable speaker, Professor Madya Dr. Maizan binti Muhammad, and the next guest lecture will be delivered by Dr. Intan Nur Aina binti Kamaruzzaman. The fifth agenda is Q&A and discussion session. The sixth agenda is certificated awarding. The last agenda is closing. The first agenda is opening. Let's start this agenda by praying according to the respective religion and belief. To all participants, let's pray together first. Pray begin. Pray finish. Thank you very much. The second agenda is opening remark that will be delivered by Dr. Wiwi Tiasningsih, Doctor of Veterinary Medicine, Master of Health, as a head of Microbiology Division. To Dr. Wiwi Tiasningsih, DVM Master of Health, time is yours.
Okay, thank you, Dr. Ate. Assalamualaikum warahmatullahi wabarakatuh. Very good morning to all the participants. The Honorable Vice Dean of Faculty of Veterinary Medicine, Universitas Airlangga, Dr. Rimayanti, DVM, Master of Science. The Honorable our speaker from Professor Madya Dr. Maizan binti Muhammad and Dr. Intan Nur Aina binti Kamaruzzaman. I apologize if I mispronounce your name. Honorable Head of Department of Veterinary Medicine, Universitas Airlangga, Professor Wijiati. The Honorable Head of Division of Veterinary Medicine, Universitas Airlangga. The Honorable Lecturers of Microbiology Division, the Honorable all students and all participants. Welcome to everyone. First of all, let us pray and praise to the Allah Subhanahu wa Ta'ala who has given us health and opportunities so that we can attend today's guest lecture event. On behalf to the committee of the guest lecture event, I would like to thank to all of you for joining to this event. This guest lecture event is a routine program as a part of the course of viral and bacterial disease lecture for fourth semester students. Therefore, this event was attended by microbiology lectures, fourth semester of undergraduate students, and attended by University Malaysia Kelantan students. So far, all the participants, I welcome you to this guest lecture event. And for today's guest lectures, the theme is viral and bacterial disease, which invited to guest lectures from University Malaysia Kelantan. Through this event, we hope that we can get and enhance our knowledge from the speakers. We would like to take this opportunity to express our thanks to our special guest, Professor Madya Dr. Maisan binti Muhammad, and Dr. Intan Nur Aina binti Kamaruzaman from University Malaysia, Kelantan, for accepting our invitation and sharing your valuable time and sharing your knowledge. Once again, welcome to the event. And finally, we hope that all of you could follow the program by please and the program be beneficial for all of us. Thank you. Wassalamualaikum warahmatullahi wabarakatuh. Back to Dr. Ateh.
Thank you, Dr. Wiwi. And now we will continue to the third agenda, which is opening speech from first Vice Dean of Faculty of Veterinary Medicine, Universitas Airlangga, Dr. Rimayanti, Doctor of Veterinary Medicine, Master of Health. To Dr. Rimayanti, DVM Master of Health, time is yours.
Yeah, thank you very much, Dr. Ratih. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. Before we start, let us praise and thanks to Allah Subhanahu wa Ta'ala for the abundance of His grace and joy to all of us, so we can still gather this morning in such good health. First, I would like to welcome Honorable the Head of the Department Veterinary Medicine Science, Prof. Widiati, and then also the Head of Microbiology Division, Faculty of Veterinary Medicine, Universitas Erlangga, Dr. Wiwi Ningsih, as well as welcome to our honorable guest lecturers today, Professor Madya Dr. Maizan binti Muhammad and Dr. Intan Nur Aina binti Kamaruzaman from Faculty of Veterinary Medicine, University Malaysia, Kelantan. Welcome in the virtual classroom of Faculty of Veterinary Medicine, Universitas Erlangga, Surabaya, Indonesia. I would like to welcome our honorable lecturers and students of Faculty of Veterinary Medicine, Universitas Erlangga, who might join this guest lecture this morning. And also welcome to the students of Prof. Madya and Dr. Maizan binti Muhammad and Dr. Intan Nur Aina binti Kamaruzaman from Faculty of Veterinary Medicine, University Malaysia, Kelantan, who attend this lecture this morning. It is my great pleasure to welcome all participants who have joined the guest lecture today in the virtual classroom of Faculty of Veterinary Medicine, Universitas Erlangga. Ladies and gentlemen, today we attend guest lecture speech about first is the zoonotic coronaviruses, will be delivered by Prof. Madya Dr. Maizan, and then second is about important bacterial diseases in veterinary medicine, economical impacts and animal welfare, that will be delivered by Dr. Intan Nur Aina. Even though these lectures and transfer knowledge are given online, hopefully all of us can obtain a great knowledge. We hope that we can learn a lot from the lecture section and we will have interesting and stimulating discussion. We know that there is a blessing in disguise in this pandemic situation, because make it easier to us to attend the meeting online without any obstacles of space and time. I would like to thank the head of Microbiology Division of Faculty of Veterinary Medicine, Universitas Erlangga, Dr. Wiwi Ningsih, and all of the lecturers in the division for organizing this event. And of course, special thanks to our speakers today, Professor Madya, Dr. Maizan binti Muhammad, and Dr. Intan Nur Aina binti Kamaruzaman from Faculty of Veterinary Medicine, University Malaysia Kelantan for delivering such important and interesting topic so we can deepen our knowledge, and we really appreciate that. Finally, I sincerely hope that all participants will enjoy the lecture, and I wish the program will be fruitful for all of us. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Dr. Rimayanti. And
Yes.
yeah, and so the next agenda is the main agenda, which we are waiting for lectures from the guest lecturer. For the presentation session, will be guided by our beautiful moderator, Dr. Yuliana Puspitasari, Doctor of Veterinary Medicine, Master of Veterinary Science, PhD. Ladies and gentlemen, please welcome Dr. Yuliana.
Thank you so much, Dr. Ati. Okay, hello, good morning, everyone. How are you? Assalamualaikum warahmatullahi wabarakatuh. So, I hope all of you are doing well during this pandemic time. So, Alhamdulillah, today we can meet in this event, even though by virtually, but inshallah, it will not reduce the meaning and benefit of this event. So I'm Yuliana Puspitasari, will be the moderator for this session. And we have two invited speakers from University Malaysia Kelantan, Associate Professor Maizan Muhammad and Dr. Intan Nur Aina Kamaruzaman. So our main theme of this event is viral and bacterial diseases, which consists of two topics. The first topic is zoonotic coronaviruses, and the second topic is important bacterial disease in veterinary medicine, economical impacts, and animal welfare. Both topics are very interesting since we know that currently the world is facing the COVID-19 pandemic. And not less important is the impact of the bacterial diseases to economic losses and also animal welfare, which is currently also become a major problem in the world. Moreover, emerging veterinary disease also become a global problem. So no need to talk more. Let's start the lecture sessions. The first lecture is zoonotic coronaviruses, will be delivered by Associate Professor Dr. Maizan Muhammad. Before we start the lecture session, I would like to read briefly about the CV of Associate Professor Dr. Maizan Muhammad. So, Associate Professor Dr. Maizan Muhammad, currently, he is Associate Professor at Department of Paraclinical Faculty of Veterinary Medicine, University Malaysia Kelantan. And for educational background and experience, Professor Maizan graduated with Bachelor of Science in the field of Microbiology from University Kebangsaan Malaysia, or UKM. She pursued her postgraduate study at the University Putra Malaysia, UPM, receiving Master of Science degree in the field of molecular biology and obtained PhD degree in molecular virology from St. Andrews University, United Kingdom. Her research area are virology, molecular biology, and molecular virology. She's also actively produced many international scientific journals and proceeding in related fields. And she also active as a membership of professional societies such as a member of International Society of Infectious Disease, ASEAN Federation of Biotechnology, National Antimicrobial Resistance Committee, and also a member of my own. So that's the CV from Associate Professor Dr. Maizan. Hello, Prof. Maizan. How are you?
Fine. Hi, Dr. Liana.
How are you, Prof? Nice to meet you.
Thank
Finally, we
you.
can meet directly, even though by online, yeah, Prof.
Yeah. Hopefully, in the future, you all can come to our to Malaysia, to our place.
Yes, yeah. We do hope that someday when the situation is safe, so we can invite you to give lecture by offline, so you can come and give lecture, come to our faculty and give lecture to our students.
Thank you. Actually, I went to Indonesia a few times before, to Bandung, to Jakarta.
Oh, really? But I think you shopping a lot, right? When you went to Bandung, because Bandung is a place for shopping.
For shopping,
Yes, because
yeah.
the price is quite cheap. Yes, Prof.
Yeah, compared to in Malaysia.
Yes.
Yeah.
Okay, Prof. Are you ready to present?
Okay. I'm ready for that.
Okay, thank you very much. Once again, thank you very much, Prof, for accepting our invitation. This is our great pleasure for having you as a speaker.
Okay,
and
me too.
For presentation, you have 90 minutes presentation time, Prof.
Okay.
Is it enough, Prof?
More than enough.
Okay, Prof. The time is yours.
Okay, thank you.
You're welcome.
Why not this one? Sorry, is this?
Do you want?
Sorry. I need to go to my slide now.
You want to share your PPT, or we can help by our committee to help you to share the PPT?
Because actually, I have my.
Okay.
You see, maybe this one. Is it this one? Oh no, sorry.
It's okay,
Because actually, I'm not so familiar with Zoom. Normally, we use Google Meet.
Yeah, sorry. Actually, Dr. Intan also told me about this. Yeah, okay. She's not familiar with Zoom.
Hold on, kejap. Just hold on. Can you pass to Dr. Intan first for the presentation?
I think Dr. Intan hasn't joined us, Prof, because she has some urgent issue. So she just texted me that she can.
Okay, let me see.
Maybe we can help you, Prof, to share the PPT?
Yeah. Let me do this first.
Okay. Actually, Dr. Intan also told me about this. Yeah, he's not familiar with it.
We are not familiar with this. Okay, now I think Now you can see my slide, eh?
Wait, still loading? Yes, Prof.
Okay, good. Good morning and Assalamualaikum to Honorable Dr. Rimayanti, Vice Dean of Veterinary Faculty of Airlangga University, and then Honorable Dr. Wiwik, HOD for Microbiology Department, Dr. Juliana as a moderator of this webinar, and then to the MC, chairman of this event, Dr. Ratih, to honorable lecturer of Microbiology Department and the students. Okay, and then also other participants. Okay, thank you. First of all, I would like to thank you all for inviting me to be as a guest lecturer here to share some of my knowledge. Okay, and then I will try my best to share this with you. Okay, thank you. Okay, can I start my presentation now?
Yes, Prof, please.
Okay, before I continue with my lecture, I would like to introduce you all a bit about our faculty. Okay, Faculty Perubatan Veterina or Faculty of Veterinary Medicine actually in the University of Malaysia Kelantan. We are actually the second veterinary faculty in Malaysia after University Putra Malaysia. So currently there are only 2 faculties, veterinary faculties in Malaysia. Okay, so our University Malaysia Kelantan actually located in Kota Baru in East Coast Peninsula Malaysia. So this is Kelantan, in Kelantan, Kota Baru in Kelantan. So we are actually sharing with Thailand, the border with the Thailand. Okay, so you know, like if we share the border with Thailand, so whatever diseases from Thailand, we will have that after a few months. Okay, for example, we have the outbreaks of H5N2, H5N1 in 204, 206, and just 2017. So all this actually when we trace the phylogenetic tree of the source of the outbreaks were actually closely related to Thailand. Okay, so this is our faculty. So we are only stationed at the temporarily at the shop lot. In shop lot lah. So we are renting this shop lot. So within these few years, we are going to move to our own faculty in Bachok. Okay, so we now still negotiating about the construction of the building. Okay, this is actually the building where our lecture hall, lecture room located, and then this is actually more to our lab. Okay, located. So we have two shop lot building for our faculty in Kota Baru, Kelantan. Okay, and then we have this clinic veterinary Veterinary Malaysia, Veterinary in Bachok. Okay, this is about 1 hour's driving from our current faculty in Bachok. Okay, and then for the history of our faculty, actually we established this faculty of veterinary medicine in UMK since 2009. So the intake is about intake of the students is about 39 students. So therefore, this is for the first intake. One of the students is actually Dr. Intan. So meaning that Dr. Intan is our alumni lah. Okay, the first batch of our student, Dr. Intan. Okay, and then this is our misi and vision and mission. Vision and mission is we aspire to be a highly reputable faculty in veterinary education. Okay, misi. Okay, and then the objective. I don't think I would spend a long time on this. Okay, so the positive values of our FPV member is fortitude. F is fortitude, P is patient, V is visionary, U is unity, and then M is mindful, and K is kindness. Okay. I guess your Wasdin of Vet faculty came to our faculty before. Is it? Dr. Rimayati, have you been in our faculty before?
Yes, Prof. Yes.
I met you before. I remember you.
Yes, I ever been there. Around 2016, yeah, Prof.
Yeah, I met you because I remember I have the picture of that.
Yeah.
Okay.
Virtual room, Prof. Now.
Yeah. Okay, can I continue with my lecture, Dr. Rima?
Yes, of course.
Okay, thank you. Okay, this is the organization chart for our academic. Okay, so we have 3 deputy dean, deputy dean for academic, deputy dean for research and innovation, and then for the hospital. For the deputy dean of research and innovation is lead by me lah. Okay, so I'm the deputy dean of research and innovation. So currently we have 22 lecturers, and then belongs to 3 departments. Paraclinical, and clinical. Okay, so we are actually in small group of people, only 22 lecturers. Okay, so any of you would like to join us, invited. Okay, sorry, the slide here not so good. So we have graduated about 7 cohorts of our students. So which actually about 268 students were graduated from us. Okay, and then for the postgraduate students, we have 18 students. local student, 18 local students, 6 overseas student. And then we altogether we have 24 students for postgraduate study, and then about 8 students are master student. Okay. Okay, and then we receive the certificate from MQA, Malaysian Qualification Agency, since 2014 until now. Okay. And then, okay, this is mobility program. So, sorry, it's in Malay. This is a mobility program of our student. You can see here we have our students went to Lahore, Pakistan, and then to University Gadjah Mada, Indonesia, University Bogor, Pertanian Bogor, Indonesia, and then to Kesat University Bangkok. Or this lah, this is all. So most probably in the future we would like to include your university too. Okay, I guess we already signed the MOU with University Airlangga, because before this our dean visited you, if I'm not mistaken, twice. Dr. Rima, twice. Dr. Prof. Azam visited you all twice before. Last year, one of the visits is last year, isn't it?
Yeah, I remember that.
With Dr. Farhan.
Yeah.
Okay.
We invite your students also, Prof. Madria, to come to.
Okay. Okay, good. Thank you. So we would like to invite your student too.
Yes, thank you.
Okay. Okay, if you can see here, the employment of our student is almost 100% lah, because not many vet students graduated every year. So almost 100% got job. Okay, let me share a little bit about our lab. So this is, we have actually all this lab, postmortem, histopathology, bacteriology and mycology, virology, clinical pathology, molecular biology, parasitology, aquatic and zoonotic lab. Okay, so our service is more for disease surveillance, providing disease diagnostic, monitor patient health status, developing and improving diagnostic technique, developing new or improved vaccine, conducting research to improve animal health and production, and then provide training to staff and student, and also for practical teaching or practical attachment. Okay, nice. Okay, for the research, for the research grant, so all this actually our research grant. Okay, I think that's all for the briefing about my faculty. So for the zoonotic corona, actually I am given with this topic for the presentation today, but I'm going to include also. It seems this one more like to the lecture for the DVM4 student, isn't it? So I'm going to include also important coronavirus disease in animals. Okay. Okay, for the coronavirus is a large family of viruses that cause respiratory, gastrointestinal, and central nervous system disease in animals and human. Okay, the first coronavirus identified in 1937 by Schock and Horn, which is actually they found this infectious bronchitis virus, or IBV, which is responsible for bronchitis in birds in North Dakota, USA. Okay, so first IBV, first coronavirus is IBV found in USA. So this is more like a Bodex strain. Okay, and then human coronaviruses was identified in 1960s from the noses of people with a common cold in USA and UK. Okay, and then coronavirus actually is the Latin words of crown. That's how the coronaviruses got their name. Okay, from the Latin words of crown. This crown actually, because of the corona-like appearance of coronaviruses, represented by the presence of spike glycoprotein. So if you see under electron microscope, you can see that the structure or the shape of the coronavirus like a crown, because the presence of these spike projections. Okay, coronavirus belongs to family Coronaviridae under the order Nidoviralis. So this is this lecture more for the student. Okay, I know the lecturer or the lecturers at your faculty knows about this. Okay, well, coronaviruses are enveloped. This is consists of a lipid bilayer with a positive sense single-stranded RNA. Positive sense single-stranded RNA, same as FMD virus. Okay, and then with a nucleocapsid of helical symmetry. So the morphology is spherical and moderately plumorphic. Sometimes they can be plumorphic in shape with average diameter of 80 to 120 nanometer. And the genome size of this virus ranges from 26 to 32 kilobases, which is actually the largest for an RNA viruses. Okay, the genome of this virus is the largest among the RNA viruses. Okay, the stability of the virus survive in stool and urine for at least 2 days, and then diarrhea to up to 4 days, and then dry at room temperature at least for 2 days. Acetone fixed light at -4 degrees Celsius and at 4 degrees Celsius and -80 degrees Celsius at least 21 days with minimal reductions. Then this virus does not survive in usually use disinfectant like ethanol. Okay, like especially ethanol with a concentration of more than 60%. So this is what the ethanol concentration that we use to disinfect the COVID-19 virus, SARS coronavirus 2. Okay. Okay, for the temperature at 56 degrees Celsius for 30 minutes in blood serum. So normally, like in my case, I have one project working on SARS coronavirus 2 in cats, and then for the positive control, I have to get the sample from the hospital that conducting the COVID-19 testing. So they give me the sample, but they inactivate the sample first at 56 degrees Celsius for 30 minutes, so that they can transfer the sample to my lab. Okay, this is the genome organization of the virus. So you can see that most of these viruses, they have this replicase 1A, replicase 1B, which is actually contains the NSP, non-structural protein 1 to 16, and then followed by the structural protein, spike, envelope, membrane protein, and then nucleocapsid protein. Okay, so, and then for certain coronaviruses, like murine hepatitis virus, they have extra protein here before the spike protein. They have HE protein. HE is hemagglutinin esterase protein. And then also actually even for the SARS coronavirus 2 also they have this. Okay, have this. Sorry. SARS coronavirus doesn't have this. Sorry, this is envelope. So only murine herpes virus, hepatitis virus have this HE protein. So structure and role of protein in coronavirus. So this virus has this spike protein. This is spike protein where the receptor binding domain RBD located on this spike protein, and then they have this envelope protein, membrane protein, okay, and then nucleocapsid protein here. Okay, so the row of this the protein M protein, this one is responsible for the transmembrane transport of nutrients and the bud release and the formation of the envelope. Okay, for the spike protein, this is actually the one that very important punya protein. Spike protein, this one. Okay, spike protein attached to the, sorry. Actually, this spike protein cleave into two protein, spike S1, spike 1 and spike 2. And this S1 actually the one that responsible in the virus recognition, in the host recognition, where they bind to the receptor on the host cell, so that after the binding, this is based on the receptor binding domain here. So after they bind, so that the virus can enter the host cell with the help of S2 that will do the fusion between the virus with the cell membrane. Okay. And then this is an N and E protein. N and E protein actually contain the several accessory protein, and several accessory protein actually responsible in the interference with host immune system, and then also responsible some of the accessory protein actually with unknown function. Okay, Coronaviridae family has been recognized and classified into 4 genera: alpha coronavirus, beta coronavirus, gamma coronavirus, and delta coronavirus. So if you can see in here, most of alpha and beta, most of the mammals coronaviruses are actually under this alpha and beta coronavirus. And then for alpha and delta, mostly from avian coronaviruses, and then also some mammals like this. Okay. So this is actually phylogenetic tree of different representative coronavirus based on the spike protein gene. So you can see here most of the mammals coronaviruses belongs to this alpha coronavirus, and then also beta coronavirus here. I don't know, because some of my words missing here. How can I see that? Because like covered by the picture of us. How to hide that?
Prof, you can put your cursor on the picture and then drag or minimize the picture. The picture of, yes.
Okay. Okay. Yeah. So that's why I said, so thank you.
Okay, welcome.
Okay. And then you can see in here for gamma coronavirus, the infectious bronchitis virus is actually under gamma coronavirus. And then for delta coronavirus, including the pig coronavirus and also sparrow coronavirus. Okay. Okay, virus diversity. SARS coronavirus, MERS-CoV, and the SARS coronavirus 2 cause severe respiratory syndrome in human. So these are actually the zoonotic viruses in human. And the other 4 human coronaviruses, for example, human coronavirus NL63, 229E, OC43, and HKU1 induce only mild upper respiratory diseases in immunocompetent cell. So actually these normal human coronaviruses, they only cause cold in the human. So this virus contribute about 10 to 50% to the normal cold in human. Alpha coronaviruses and beta coronaviruses pose a heavy disease burden on livestock. For example, porcine transmissible gastroenteritis virus or TGEV and porcine enteric diarrhea virus PEDV. So they really cause severe disease in livestock. Based on sequence databases, all human coronaviruses have animal origins. For example, SARS coronavirus, SARS coronavirus 1, MERS-CoV, human coronavirus and L63 and 229E are considered to have originated in bats. And then human coronavirus OC43 and HKU1 are likely originated from rodents. Okay, so you can see that most of the especially human coronaviruses are originated from the bats. Okay, and then domestic animal as an intermediate host, which enable virus transmission from natural host to humans. So normally the transmission is not directly from the wildlife. Okay, so to transmit to the human, so they are actually intermediate hosts. Okay, so the intermediate host will get infected and then transfer the virus to the human. Because normally intermediate hosts, they are more in close contact with the human. Okay, for the replication, for the replication of the virus, so using the S protein, coronavirus will bind on cell surface molecule. For example, in the case of SARS coronavirus 2, actually they have to recognize the ACE2 receptor on the human cell. ACE2 receptor is angiotensin converting enzyme 2. So that when the spike protein of the coronaviruses recognize this receptor on the animal or on the host, so that they can enter the host cell through the fusion of the S2 spike 2 protein with the host cell membrane. Okay, and then after that, since coronaviruses, they have a single positive strand RNA genome, they can directly produce their protein. Okay, so that straight away they can produce the protein. Straight away the RNA itself can be translated to the protein. Okay, and then they can directly produce the protein and new genome in the cytoplasm. So at first, the virus synthesizes its RNA polymerase that only recognize and produce viral RNAs. The enzyme synthesizes the minor strand from positive RNA. They will produce the minor strand using the positive strands as a template. Okay, and then the negative strands serve as template to transcribe smaller subgenomic positive RNA, and then which are used to synthesize all other proteins. And these negative strands RNA also serve for replication and new positive strands RNA genome. Okay, the protein end bind to the genomic RNA, and then the protein end is integrated into the membrane of the endoplasmic reticulum, and then And then like the envelope protein SNHE, after binding, assemble nucleocapsid with helical twisted RNA back into the ER lumen and then encase with its membrane. Okay. Okay. And then viral progeny are finally transported by Golgi vesicles. Okay, the transmissions. Transmission are through aerosol, through fomites, and or fecal oral routes. Okay, and then infected animal or human are able to shed viruses into the environment. The interaction of the coronavirus spike protein with its specific cell receptor. So meaning that the interaction need to be between spike protein with the specific cell receptor. Meaning that the RBD receptor binding protein on the spike protein need to recognize the cell receptor on the host cell first. Okay, and then this is actually the central in determining the tissue tropism and species range. Okay, if let's say the RBD of the spike protein of certain viruses, they can recognize many receptor in many animal species, so they can cause the disease in many animal species lah, right? Like Nipah virus, they recognize cell receptor of many animal species cell, and then they can cause disease to human, to tiger, to cats, all this lah. Okay, and then coronaviruses mainly target epithelial cells. Human coronaviruses infect the epithelial cell of the respiratory tracts. Okay, through the for example, in the case of SARS coronavirus or coronavirus 2, so the transmission is through aerosol, and then the receptor of the cell of the human cell is ACE2, angiotensin converting enzyme 2. While for animal coronaviruses, they infect the epithelial cells of the digestive tract. For example, in the case of TGEV, so the transmissions is through the fecal oral routes. Okay, and then they use this alanine aminopeptidase receptor or APN receptor to enter the pig host cell. Prevention and treatment. A number of vaccine kill mRNA, vector and recombinant, like the vaccines that we have for the COVID-19, using different methods have been developed against human coronavirus SARS-CoV-2, SARS coronavirus 2, which is actually the virus that causes COVID-19 infection. Okay, again, antiviral against human coronaviruses have also been identified, such as viral proteases, polymerases, and entry proteins. Okay, drugs that targeting specific protein of all these SARS coronavirus 2, SARS coronavirus, and MERS-CoV, and the specific one is still under development, meaning that until now we don't have the antiviral for all these three zoonotic human coronaviruses. So we just try and error using antiviral yang currently we have for treatment of other viral diseases. Yang specific to these three zoonotic coronaviruses in human, until now we still don't have that, because as you all know, this to produce this antiviral actually really takes time lah. Okay, and then vaccines are available for animal coronaviruses, for example, for infectious bronchitis virus, TEGV, FIPV, and canine coronavirus, although their effectiveness is limited. Limited, why limited? Because due to the many strains of this virus. Okay, for example, in the case of infectious bronchitis virus, I give you all the example in Malaysia. So far, because this is actually part of my MSc study with University Putra Malaysia, so we characterize all the infectious bronchitis virus prevalence in Malaysia in up to year to the year 2000, and then we found that actually, because we always have the cases of infectious bronchitis in our chicken, even though that farms, all the farms too actually already vaccinated with the imported vaccine. Then when kita characterize too, because we puzzle why, because most of the farms too they actually vaccinated but with the imported vaccine. So bila kita sequence and then tengok we see the sequence of the, kita buat sequence analysis of our IBV strain, we found that actually our IBV strain is more to the local strain. And then that's actually make us want to do the protection study. When kita buat protection study, this is actually my study when I was with Veterinary Research Institute. Because actually in my case, for my profession, I just joined the university since 2009. And then from 1991 to 2009, I was with VRI, Veterinary Research Institute in Ipoh, Perak, with the Department of Veterinary Services. Okay, so when we sequence all the local IBV strains that cause the problem in our chicken, we found that actually the local strain of Malaysian local strain too actually totally different, more to like novel strain of infectious bronchitis virus. So and then we did the challenge study, we found that actually all the imported vaccine memang with no protection for our local strain. And then sad to say, that one is my study in 2000. And then sad to say, until now we don't have a vaccine for our local strain. We don't have a vaccine from our local strain. I don't know why. Okay, maybe it's difficult to produce vaccine for infectious bronchitis virus. I don't know. Okay, and then in the case of outbreaks of highly contagious animal coronaviruses such as PEDV, measures such as destruction of entire herd of pig may be used to prevent transmission to other herds. Okay, these are the list of important coronaviruses in animals and human. Okay, so you see this is TEGV in pigs cause diarrhea with 100% mortality in piglets less than 2 weeks old. And then PEDV, this is in pigs also, cause severe watery diarrhea. And a feline infectious peritonitis virus in cats, cause fever, vasculitis, and serositis with or without effusions. And then, the bovine coronavirus cause diarrhea in cow. And then IBV in chicken cause severe respiratory disease. Then for the important coronaviruses in human, is SARS coronavirus, MERS-CoV, and SARS coronavirus 2. Okay, if you can see in here, in terms of the mortality rates, the highest mortality rate caused by the MERS-CoV, about 37% of the mortality rate. And then SARS coronavirus, 10%. And SARS coronavirus 2 is only 2%. But in terms of spreading of the virus, spreading rates, transmission rates is the highest in the SARS coronavirus too. Okay, infection in animals. Okay, infection coronaviruses in domesticated birds, for example, infectious bronchitis virus that cause infectious bronchitis in chicken, and then coronavirus in farm animals, in pig, swine acute diarrhea syndrome coronavirus, which is related to bat coronavirus HKU2, causes diarrhea in pig. Okay, and then porcine epidemic diarrhea virus (PED) is a coronavirus that has recently emerged and similarly causes diarrhea in pigs. And then this is the one that even we have this in Malaysia. I think in Indonesia too, transmissible gastroenteritis virus, which is a member of the species Alpha coronavirus 1, which cause severe diarrhea in young pigs. Normally for TGEV, the mortality is 100% lah. Okay. Okay, for cattle, bovine coronavirus, which is a member of species Beta coronavirus 1 and then related to human coronavirus OC43, responsible for severe profuse enteritis in young calf. Then in domestic pets, coronavirus in cats. Coronavirus in cat, the one that can cause severe disease with high mortality is feline infectious peritonitis or FIP. FIP actually is a mutant, meaning that they emerge from the this feline enteric coronavirus, which is actually feline enteric coronavirus is very common in our cats. And then this feline enteric coronavirus cause a minor or mild clinical significance, and normally just mild diarrhea. And then, but 5% of this FECV can mutate to feline infectious peritonitis virus, and then it can cause high mortality in cats. Okay, this is actually feline coronavirus, FIP is very common in our cats, even in Kelantan itself. Very, very common. Okay, and then coronaviruses in dogs, canine coronavirus, which is a member, which causes mild gastrointestinal disease in dogs. Okay, they cause mild gastrointestinal disease in dogs, and then canine respiratory coronavirus, which is a member of the species Beta coronavirus 1 and related to human coronavirus OC43, which cause respiratory disease in dogs. Okay, and then coronavirus in ferrets, ferret enteric coronavirus causes a gastrointestinal syndrome known as epizootic catarrhal enteritis, and then known as ferret systemic coronavirus or FSC. Okay, feline. Let me, because you are a vet student, so I will go through all the important coronaviruses infection in animals. Okay. So feline infectious peritonitis. This is I am based more on the Malaysian station. So I guess in Indonesia too, you have all these viruses lah. Okay, feline infectious peritonitis is a fatal and incurable immune-mediated disease caused by feline infectious peritonitis virus, which is a mutated feline enteric coronavirus. Okay. So antibodies for this feline enteric coronavirus are present in as many as 90% of the cats in catteries and 50% of those in single cat household. But however, less than 5% of these FECV infected cats develop to FIP. So only 5% mutates of FECV mutates to FIPV. Okay. And then even currently we don't have system to differentiate between FIPV with the FECV. Except you have to relate that with the clinical sign observed in the animal. Okay, transmission is FECV is very common, especially in places where large group of cats are kept together. For example, in animal shelters, in catteries, etc. And then cats become infected by inhaling or ingesting the virus. The most commonly source of transmission is through the feces and contaminated surfaces, such as food dishes and clothing. Okay, despite the high prevalence of FECV, most infected cats do not develop FIP. Okay, often exposure to FECV produces no clinical sign, but many cause a mild diarrhea. Therefore, a cat without clinical sign may still be an FECV. Cats without clinical sign, but they harbor this FECV, so they can be carrier, and then this FECV carrier. So remember, 5% of FECV carrier can develop FIP. Okay, the symptom of FIP vary depending on strain of virus involved, okay, the status of the cat's immune system, and then the organs affected. Okay, two forms of diseases were reported for the FIP. Two forms of diseases reported: wet and dry. Wet is a effusive form, which is actually targeting the body cavities, and then dry, non-effusive form, dry FIP targeting the various organs. Okay, the wet form tends to progress more rapidly than the dry form. But in either case, the body condition suffers with the hair coat become rough and dull. And then the cats become increasingly lethargy and depressed. Okay, this is the symptom of wet FIP and then dry FIP. For so wet FIP, the obvious symptom you can observe is to differentiate between this form. You can see the gradual swelling of abdomen or pot-bellied appearance, diarrhea, poor appetite for the wet, weight loss and lack of appetite, persistent and unresponsive fever. So persistent and unresponsive fever, because even though the animal, infected animal, the patient too been treated with antipyretic drugs, so but the fever too still not coming down. Okay, and then okay, accumulation of fluids in the chest cavity, breathing difficulties, sneezing, runny nose, and lethargy. All this for the wet form of FIP. And then for dry form or non-effusive FIP, you can observe poor growth in kitten, anemia, jaundice, diarrhea, fever, depression, inflammation of various parts of eye, neurological symptoms. For example, loss of ability to coordinate movement, loss of vision. Okay. For the diagnosis, based on the histological examination on infected tissue, and then based on clinical signs, for example, the presence of anorexia, lethargy, weight loss, pyrexia, ocular and neurological signs, and then you can see also high protein contents in the serum. Okay, for example, a globulin content of more than 30% in serum, and then this is, we call it as hyperproteinemia. And then you can see the ratio of albumin with globulin lower than 0.4 is suspected of FIP lah. Okay. And then for antigen detection using immunochemistry, immunohistochemistry, and then RNA detection by RT-PCR, and then serological test lah, indirect fluorescent antibody technique and ELISA. But the serological test ni normally not really conclusive lah the results, because the prevalence of FECB too high in cats. Okay. Okay, control and treatment. Once clinical sign of FIP develop, it is generally an incurable and fatal disease. So the survival rate is very low lah. Okay, and then through the supportive treatment, given the anti-inflammatory drugs may help relieve some sign and improve quality of life. This is only temporary, but in most cases, euthanasia is the most human course of action to avoid suffering. Sometimes very sad, we have to euthanize the FIP cats. Then good practice and hygiene to minimize the risk of FIP would include avoid keeping large group of cats and having multiple litters of kittens at any one time. And then keep cats in small isolated group, and then have 1 litter box per 2 cats, located in easy place to clean and disinfect areas, and keep litter boxes away from food and water bowls. And then for cleaning, should use bleach diluted 1:2 with water. They avoid stress and maintain good hygiene. So the second important animal coronaviruses is infectious bronchitis virus. Infectious bronchitis is an acute, highly contagious disease of major economic importance in commercial chicken worldwide. It is caused by a coronavirus that only causes disease in chickens. Although some other birds also can infected with this virus, but only showing the subclinical disease. Okay, it is characterized by, the disease is characterized by respiratory signs, although decreased egg production and poor egg quality in breeders and layers also can be seen, and some strains are nephropathogenic, which cause intestinal nephritis, especially in the chick. So you can see in here that 3 forms of diseases that can caused by infectious bronchitis virus. Respiratory form, reproductive form, and then this nephropathogenic strain that can cause lesion to the kidney. Okay, and then some serotype are geographically restricted. For example, like in Malaysia, we have the IBV strains that are restricted only for our local strain, which is actually, if you compare the sequence of the IBV Malaysian local strain, dia punya different with other strain, with other IBV strains, about 30% different. So they are more to like our local strain lah. Okay, and then some serotype are geographically restricted, but multiple serotype commonly co-circulated in one geographic region. Okay, for example, in the recent year, a novel IBV genotype, the QX strain, caused severe egg production and respiratory problem that has become increasingly common in Asia and Europe. Okay, and then in terms of the disease, the strain that cause the disease, they are keep on fluctuating. For example, when my early time with VRI last time in 1991 to 1995, so we have more to the respiratory strain, and then after that, up to year 2000, 2005, we have more to the nephropathogenic strain, with you can observe urates on the kidney, all this. And then after that, more to the reproduction and respiratory disease. Okay, transmission IBV is shared by infected chickens in respiratory discharge and feces, and can be spread through aerosol ingestion of contaminated feeds and water, and also in contact with contaminated equipments and clothing. Okay, normally all these are contaminated with feces from the infected animal, from the infected chicken lah, all this equipment and clothing. Okay, naturally infected chickens and those vaccinated with live IBV may shed virus intermittently for up to 20 weeks after infection. So this is actually what make our diagnosis difficult, because you see the vaccine, even the vaccinated chicken with the live virus can shed virus intermittently for up to 20 weeks. So sometimes we can, when we have the outbreak suspected of IB, so we did PCR, RT-PCR on the sample too. We got a positive with that, whereas actually that one, the positive one, is from the vaccine itself. Okay, and then incubation period is generally 24 to 48 hours with a peak in excretion of virus from the respiratory tract lasting 3 to 5 days after infection. Okay, severity of disease are influenced by strain of the virus, age, immune status, diet, and co-stress, and then co-infection with bacteria. For example, Mycoplasma galliseptica, Mycoplasma synoviae, E. coli, and then Avibacterium paragallinarum. Okay, final findings. Clinical findings. Morbidity is commonly close to 100%. But infection with respiratory strain, you can observe coughing, sneezing, and have tracheal raise for 10 to 14 days. And then sometimes you can see conjunctivitis and dyspnea, and facial swelling, particularly with concurrent bacterial infection of sinuses, and then cheek may appear depressed and harder under heat lamps. Then feed consumption and weight gain are reduced. Okay, and then this is respiratory strain. For the nephropathogenic strain, they can cause initial respiratory sign, then later depression, ruffle feathers, sweat dropping, greater water intake and death. And then for the reproductive strain, you can see the drop in egg production as much as 70%. And then the eggs normally misshapen with thin, soft, rough, and pale shells, and can be smaller and have watery albumin. Sorry, the red font is not so good here. In most outbreak, mortality is 5%, although mortality rates are higher when disease is concurrent with the infection of the bacteria. Okay. And then nephropathogenic strain can induce interstitial nephritis with high mortality up to 60% in young chicks. In our case, the first nephropathogenic strain that was detected in Malaysia, that one can cause 40% death in the chicks. Okay, infection of young chick may cause permanent damage to the oviduct, and that never reach normal level of production. Okay, for the diagnosis, viral isolation, using specimen for respiratory tract, kidney, oviduct, and feces by inoculation into 9 to 10 days old embryotic chicken egg via intra-allantoid, and then few passages to produce characteristic stunting and culling of embryo. Because if you use this method of viral isolation in embryotic chicken egg, for the fish strain, you need to passage at least 3 passages. So 1 passages normally will take 1 week. So 3 passages about 3 weeks. So to get the results of this like stunting and culling of the embryo of the fish strain, so you need about 3 weeks lah. For this, that's why now, for the diagnosis, what you have to do first, we have to do the molecular RT-PCR first. First, we proceed with the viral isolation lah, because Kalau you nak wait for the virus isolation, it will take you about 3 weeks to get to isolate the virus. To see all these characteristic of stunting and curly of the embryos lah. Okay. RNA detection by RT-PCR and then serological test using AGID and ELISA. So for the and then you can see rise of antibody titer between acute and convalescent serum by SNT and HI lah for to diagnose the IBV. Okay, and control dia, no medication for IBV infection, no antiviral. And then antimicrobial therapy to reduce mortality caused by the complicating bacterial infection. The attenuated vaccine may produce mild respiratory signs. This vaccine are initially given to 1 to 14 days old chick by spraying, drinking water, eye drop, and birds are commonly re-vaccinated lah. So kena booster. So in Malaysia normally we use yang booster type tu, yang second vaccination tu we use different strain lah, more to the vaccine yang contain the variant strain lah. Okay, so that we hope that vaccination using different IBV strain will one of the vaccine will give protection to our local strain. Okay, and then use of attenuated or adjuvanted inactivated vaccine in breeders and layers to prevent egg production losses. Okay, control the vaccine selection should be based on the knowledge of the most prevalent serotype in the premises. Macam example dia in Malaysia, we have more to local strain. So even though we use the imported vaccine, M41 or H120, so and then normally all these strain won't give the protection lah to our local strain. So that's why we have to use vaccine using different strain of the vaccine lah. So we hope that one of the vaccine too will give protection to our local strain. Okay, vaccination with selected variant serotype may be of use when these variants are the dominant strain in flocks. And then, okay, for the TGE, TGE, transmissible gastroenteritis, is an acute, highly contagious disease of pig. The disease is characterized by severe diarrhea and vomiting with high morbidity and mortality in piglets. Okay, recently, a respiratory variant of the TGEV virus, known as the porcine respiratory coronavirus, emerged in Europe, causing interference in the diagnosis of TGE. Okay, only occurs in pigs. Cats, dogs, and foxes has been described as potential carrier without clinical sign of the disease. I don't know whether this is common in Indonesia, TGEV. Is it common in Indonesia? Hello. Don't know, Okay, transmission of TGE. Transmission of TGEV, outbreak of TGE usually start following the introduction of infected pigs, and then subclinically infected animal can be a source of infection. Okay, so they are carrier, and recovered pigs often become carriers and can shed the virus for 2 to 3 weeks in their feces. So remember, the recovered pigs can be carriers. So bila recovered, they don't show any clinical sign, but they can carry the virus and then they can cause infection to the new animals. Especially they carry the virus in they excrete the virus in their feces lah. Okay. Okay, the exact mechanism of transmission are still unclear. The proposed means are fecal-oral contamination, milk from infected sows, and then contaminated litters, non-pig, such as dog, cats, and foxes, infected drinking water, and the infected husbandry material. Okay, and clinical sign dia, So when introduced into a susceptible pig, susceptible herd, TGE spread rapidly. Pigs less than 2 weeks are the most severely affected. Okay, clinical symptoms include vomiting, profuse diarrhea with false negative, often containing curds of undigested meal, weight loss, dehydration, death in 2 to 7 days. Mortality can reach 100% in pigs less than 1 week. In all pigs, a mild disease occurs with the sign of inappetence. And then diarrhea, galactia in lactating sows. Okay, for the diagnosis, sudden onset and rapid spread of diarrhea in newborn pigs with almost 100% mortality, suggestive of TGE. Okay, and then virus isolation using swine testicle cell, and then antigen detection in mucosal smears or cryostat section of small intestine by FAT and also in feces by ELISA, RNA detection by RT-PCR, serological test by SNT and competitive ELISA. Control and prevention, commercial oral injectable attenuated virus vaccine appears to be better at boosting immunity. Okay, and then treatment of TGE should also include in alleviating dehydration and starvations. To reduce risk of spread, only introduce animals from serological negative herds and sterilize the swills. Okay, control and prevention, if an outbreak occurs, so good hygiene practices can help reducing the impact of the disease, since it appears to be very difficult to eradicate the disease. So we need to eradicate the disease. We need to, one of the way is isolate newborn piglets. And then the other approach aim to minimize the duration of the disease by exposing all the pregnant sows to the disease to develop transplacental immunity of parus. Jadi we want to develop the maternal antibodies lah to the young to the piglets, to the newborn piglets. So because as we know, this TGEV is actually susceptible to the piglets only. Okay, porcine epidemic diarrhea virus. It is a contagious disease transmissible mainly by the fecal-oral routes, also referred as porcine epidemic diarrhea syndrome. And then characterized by watery diarrhea and weight loss. First reported in 1971 in United Kingdom and affects pigs of all ages, but most severely in neonatal piglets. Okay, morbidity and mortality can up to 100%. And then the mortality is decreasing as age increases because only this virus only susceptible to the piglets. Okay, the disease similar to other porcine gastroenteritis, including anorexia, vomiting, diarrhea, and dehydrations. Okay, transmission dia direct transmission or indirect transmission. A direct transmission through ingestion of virus contaminated feces, and then indirect transmission through vehicle, personal equipments, and then all the equipments that or the surface that contaminated with feces, including feet. And then incubation period. The incubation period is estimated to be between 1 and 4 days, but infectious period can last between 6 and 35 days. Okay, the pathogenesis. Oral injection results in viral replication in the epithelial cell of the small intestinal and colonic villi, resulting in degeneration of enterocytes, leading to shortening of the villi, and then this causes clinical manifestation of the disease, including the watery diarrhea. Okay, the clinical sign, depending on the age of pig, pre-exposure and immunological status of the pig, presence of secondary infections. Okay, and then the following signs can be found in PED virus infection, morbidity up to 100%, mortality varying according to the age. In suckling piglets up to 100%, piglets older than 10 days less than 10%, adults and fattening pigs less than 5%. Then also you can observe diarrhea and vomiting and dehydration. Okay, lab diagnosis. Sorry, this what I share with you all because since you are a vet student, and then I thought that I have to give this to all the vet students. Okay, lab diagnosis, sample the fresh feces, oral fluid, small intestine, serum can be used to determine the presence of the antibodies. And then, okay, and then diagnosis method, the identification of the agents, reverse transcription polymerase chain reaction or RT-PCR, and then ELISA, immunohistochemistry, IHC, virus isolation, but it's very difficult to isolate this virus, and then serological test. Okay, prevention and control, no specific treatment, meaning that there is no antiviral for this disease. So normally treatment is based on the symptom showing, such as symptom of diarrhea and control of secondary infection. Most growing pigs recover without treatment within 7 to 10 days unless secondary infection occur. Okay, reinfection may occur when the immunity wanes. And then maternal antibodies via colostrum from the immune cells, and then PED vaccine are available. Strict biosecurity is most effective measure to prevent the introduction and spread of the virus. And then introduction of the pigs from the known health status, on-farm movement control of pigs, the implementation and maintenance of high biosecurity programs. This is okay, and then practice the all in and all out. So this all in and all out practice has been demonstrated to be effective in breaking the transmission cycle within a farm. Okay, bovine coronavirus, a member of the species Beta coronavirus 1, infect both domestic and wild ruminants and has a worldwide distribution. So the transmission is through the horizontal via oral, fecal, or respiratory routes. Then this virus have a shorter spike-like surface protein in its genome called hemagglutinin esterase. So meaning that bovine coronavirus also have this protein lah, HE protein, beside that murine hepatitis virus just now. 95% similarity with human coronavirus OC43 and 93% to porcine hemagglutinating encephalomyelitis virus. Clinical sign there, infection 1 week and 3 months old calf. And then gastrointestinal sign include profuse diarrhea, dehydration, depression, reduced weight gain, and then anorexia. Okay, respiratory infection in the calf produce a serous to purulent nasal discharge. Clinical sign may worsen when may become more severe with secondary bacterial infection. Okay, infection in adults is normally subclinical. Okay, clinical sign of this infection in adults is normally subclinical, except the winter dysentery, which affects house cattle over the winter month. So clinical sign of this winter dysentery outbreak cases is profuse diarrhea and a significant drop in milk yield. Okay, diagnosis dia, presumptive diagnosis can be made based on history and clinical sign, and definitive diagnosis kena confirm with the lab diagnostic. Kena diagnose in the lab. Okay, for example, using electron microscopy and ELISA on a fecal or tissue sample in respiratory disease, diagnosis is confirmed by performing a direct fluorescent antibody technique on nasal washes, and which identifies the viral antigen and the RT-PCR to detect the virus nucleic acid. Treatment and control, vaccinating the dam with a live vaccine. RC is pregnant as this provide antibodies to the virus in the colostrum, and then good ventilation of housing that can reduce the disease incidence. Okay, so this is now we go to the important zoonotic coronaviruses in human. Okay, so far there are actually 7 coronaviruses reported in human, and then 4 of these coronaviruses cause normal or mild disease, and then 3 including the latest SARS coronavirus 2 that caused the COVID-19 infection are actually a novel coronaviruses in human. Okay, so in here, most of the human coronaviruses are under the alpha and beta coronavirus. Okay, so most are under alpha and beta coronavirus. So these are all the coronaviruses in human to date lah. Okay, maybe there are more, but we couldn't find that yet. Okay, so as you can see that normal coronavirus can cause 5 to 10% of common cold in temperate temperature countries. Okay, novel zoonotic coronaviruses. So these are 3 novel zoonotic coronaviruses: SARS coronavirus, MERS-CoV, and then SARS coronavirus 2. So all these 3 viruses under beta coronaviruses. Okay, for severe acute SARS coronavirus 2 identified in 2003. After that, 10 years after that, we identified this MERS-CoV coronavirus in 2012, and then SARS coronavirus 2 in the late of 2019. Okay, why we call this novel? Because no herd immunity detected, and then the current no cross protection between the antibodies of the antibody that currently present in the humans towards these 3 novel coronaviruses. So bila no antibody cross protection, meaning that if you are vaccinated with any human coronaviruses, so that you are vaccinated or infected naturally with these human coronaviruses of other strain, so you won't get protection because no cross protection. Okay, and then this is the characteristic of all these 3 novel coronaviruses in human. You can see in here. Okay, for the MERS, if you see in here, average ratio there, this one is so far until 15 June, 15 June 2012, we have for the MERS-CoV we have 2,494. For the MERS-CoV, SARS coronavirus 8096, and then this is for the COVID SARS for the COVID-19 cases. More than 176 million of cases worldwide. Okay, and then the death, you can see the death, even though the fatality rates are the highest in MERS-CoV, but the death in the SARS coronavirus is already more than almost touching the 4 million. Okay, because you can see that we got a lot of cases with the COVID-19 virus, and then this indicating that the virus is the infection rate is still very high. Okay, virus evolution, how the virus can evolve, the coronaviruses can evolve, and then make they severely infected the human, because when a virus replicate or makes copies of itself, it sometimes changes its nucleotide or amino acids a little bit. These changes are called mutation. So because the virus they can mutate, especially the RNA viruses, because RNA viruses they don't have the proofreading mechanism. So bila error during the replication tu cannot be repaired by the enzyme, the host, because they don't have proofreading activities lah for the enzyme in the RNA viruses. Enzyme yang used for the RNA replication to RNA dependent RNA polymerase. So RNA dependent RNA polymerase, they don't have proofreading activities compared to DNA viruses or DNA for the DNA, they have this DNA dependent DNA polymerase. So they have this DNA dependent DNA polymerase. They have the proofreading mechanism, meaning that during the replication tu, if they have the error during nucleotide error or whatever during the replication process, so the enzyme ni can repair the error, so that they can go back to asal lah, to original one. Only maybe only a few nucleotide je yang the one that they cannot repair. But for the RNA viruses ni, dia akan accumulate, the mutation to will accumulate, and then that's why the emergence of many novel coronaviruses. For example, in the case of IBV in Malaysia lah, so there are more to local strain. So they dah mutate and then produce the novel strain of IBV. Okay, and then these changes results in a virus variant that is better adapted to its environment compared to the original virus. The process of changing and selection of successful variant is called virus evolution. Okay, and then some mutation can lead to change in a virus characteristic, such as altering the transmission that makes the virus spread more easily, then change in the severity, so the virus can cause more severe disease, or interspecies transmission, or escape diagnostic detection, treatment, and vaccine response. Okay, because escape diagnostic detection ni macam just now lah, dia no cross reaction between the antibodies, so that the current antibody, if we use antibody based punya diagnostic, so it won't pick up this novel virus lah. Okay, if we use the antibody based diagnostic system. Okay, and then how do these zoonotic viruses emerge? So this is through the mutation. This now mutation which alter host range and tissue tropism. A mutation either through the gene deletions, insertion, or substitution, targeting spike protein receptor recognition and membrane fusion are critical in determining the host range and tissue tropism of coronaviruses. You can see here lah, like this is based substitute certain base with other base. Okay, and then this base deletion, delete a certain base, so that when all this happen, some of the addition or deletion to will affect the translation of protein lah. Okay. Okay, and then for coronavirus, the mutation occur 1 in 300 nucleotides. Okay, sorry, 1 in 3,000 nucleotide. Okay, per replication cycle per virus. So example, for the SARS coronavirus genome, they have 3,000 nucleotide. Okay, 30,000 nucleotide. Okay, so the doubling time of the SARS coronavirus is 2 days. So there we have 10 mutation per virus per cycle per 2 days. In the 2 days, there we have per one virus, there we have 10 mutation. So they will produce doubling time or generation time is the time taken from one virus to double themselves. From one virus to two viruses. So doubling time for the SARS coronavirus is about 2 days. So you can see how this mutation accumulates, and then because they don't have proof reading enzyme activities, so the chances for them to produce the novel viruses is higher. Okay, through the recombination process. Recombination process is exchange of genetic material. This is very common in the coronavirus. Okay, recombination, exchange of genetic material. So when the host infected with two strain of the viruses, this is example beside the coronavirus, the one that can mutate through the recombination can recombine their genetic material is okay. I give here is HIV example just to show you how recombination takes place. How recombination occur. Okay, so you can see the progeny virus is consists of the genetic material of the two parents here, and then they will lead to they will produce many macam for the example in the case of HIV ni many subtype of HIV strain, and then when so many subtypes produce, so what happened to the vaccine or antiviral for the vaccine? It's very difficult to produce the vaccine for HIV. So until now, we don't have effective vaccine for HIV because dia banyak subtype. Okay, and then the mutation and recombination that occur in the spike one protein of the coronaviruses can alter host range and tissue tropism, which cause the jumping species. If the jumping occurs in the animal to human, so this one produce the zoonotic virus. Zoonotic virus is the virus, the infection that cause the virus jumping from animal to human. Okay, virus evolution, origin and evolution. The large number and global range of bat and avian species that host virus have enabled extensive evolution and dissemination of coronaviruses. Birds and bats are ideal natural reservoir for the coronavirus gene pool. Example, bats are the reservoir for alpha coronaviruses and beta coronavirus, and then birds reservoir for gamma coronaviruses and delta coronaviruses. So you can see here, you can see that in alpha and beta, there are a lot of closely related bat viruses, coronaviruses here. All this bat. All these bat coronaviruses. Okay, coronaviruses are found in bats all over the world. So anytime these coronaviruses in bat can spill to humans, spill over to human, and they cause the zoonotic or zoonotic zoonotic viruses in human. Okay, virus origin and evolution, SARS coronavirus 2. The ancestor of the SARS coronavirus 2 first infected leaf nose bats of the genus Hippocidaridae, and then subsequently they spread to horseshoe bat in the species Rhinolophidae, then to Asian palm civets, and finally to human. So meaning that the transmission is first from the bats to the palm civets, and then to the human. Okay, this is a jumping species. Okay, mutation in RPM, receptor binding motif at amino acid residue 479 of the spike protein 1 had an important role in human transmission of SARS coronavirus, which affect the binding to the ACE2 receptor of human cell. So normally, the virus that have this arginine at amino acid position of 479 of the spike protein 1, they can recognize this ACE2 receptor of human cell. So when they can recognize this, they can enter the human host, human cell, and then cause disease to the human. Okay, and then K479N and S487T mutation in the RBD receptor binding domain of severe isolates increase the binding affinity to the human ACE2 receptor. K is lysine, N is asparagine, all these amino acid, the name of amino acid. And then S replaced, serine replaced by threonine. So this one, so if a mutation occur in this amino acid position of the S1, from K to N from at the 479 amino acid position, and then S to T at 487 amino acid position, so they will increase the binding affinity to human ACE2 receptor. Okay, and
yes. Sorry for interrupting you, but you have 5 minutes left for the presentation time.
Okay, sorry. So can I skip this? Can I skip this?
Yes, Prof.
Okay.
But you still have 5 minutes.
Because I still have for this zoonotic virus. Okay, SARS coronavirus. So I just go through this. Okay, beginning of SARS history, October 2002, Guangdong province in southern China, 2 members of family suffered from pneumonia. And then for 3 months, small cluster of virus pneumonia occurred. The patient in hospital in Guangdong infected 28 of the medical staff. A sick nephrologist from Guangzhou traveled to Hong Kong and then to Hotel M, and in the hotel infected a couple from Toronto, a businessman who traveled to Vietnam, 3 people who traveled to Singapore, and some Hong Kong people in residence. All this initiated large outbreak in these countries. Okay, and then natural host, I think this one no need. Okay, and then pathogenesis infection of the epithelial cell of the lower respiratory tract, viremia spread to the other organs, including the liver. And then the clinical cause there, they have incubation period of 2 to 14 days, from mild to severe disease, and then they have tri-phase of the disease pattern. First week, fever, and then 2 to 3 weeks is dry cough and difficulties in breathing, and then after that they will show the pneumonia, and then 3rd phase is pulmonary destructive phase, okay, which requiring the ventilatory support, and then intensive care, and then death. Okay, and then death normally from 3% to 10% due to progressive respiratory failure. Okay, SARS definition is fever more than 38 degrees Celsius, and then one of more symptoms of lower respiratory tract infection, a cough, shortness of breath, radiographic evidence of pneumonia, and then a lab confirmed cases. And then close contact with a person who was a suspected or probable case of SARS within 10 days of onset of symptom of travel to SARS documented area. Lab diagnosis, RT-PCR, antibodies detection, and then viral isolation. So this is viral infected cell for SARS coronavirus, and then transmission, close direct contact through large droplet from cough or sneeze, and then respiratory secretion, and then less frequent transmission through vaporized droplets, indirect transmissions through water, clothing, hand, food, and surfaces of contaminated with secretion, fecal transmission, and then shedding, virus found in sputum, tears, blood, urine, and feces. Okay, and then factor influencing the transmission, the size of inoculum, and then from the whether the asymptomatic person can transmit this disease or not. Okay, treatment, supportive care for symptom. Okay, and then I think for treatment, no need to countermeasures, close contact of probable or suspect case of SARS are at high risk of becoming a case and should be isolated in the community during the potential incubation period. And then the recovered patient will be quarantined at home for at least 14 days. Okay, this is an antiviral drug. Stay under extensive research, and then ribavirin, the use of ribavirin stay uncertain, and then use of the interferon alpha as a convalescent plasma, and the vaccine, no vaccine available. This is for the prevention. Prevention, I think same as the SARS coronavirus 2. Okay, this is in Malaysia. Okay, MERS-CoV, Middle Eastern Respiratory Syndrome coronavirus, first known onset March 2012, and total cases 2,590, total death 941. And then countries reported cases 27. Okay, this data is until June 2021. Okay, overview of MERS-CoV. I think I better escape this. The origin, okay, I already mentioned this before. Okay, transmission is through the water droplet. They expel from the lungs when a person breathes, cough, and sneeze. And then close contact with a person who is infected with the virus. People at risk, children, elderly, people with immune system problem, chronic heart, lung, and kidney problem, pregnant women, people with diabetes. Then a person who has traveled to one of the locations that has been confirmed by lab tests, they are positive for MERS-CoV. Okay, all the symptom, fever, almost same as SARS coronavirus 2. Cough, runny nose, shortness of breath, pneumonia, chest, body ache, sore throat, headache, vomiting, nausea, and diarrhea. So symptoms normally develop 2 to 14 days after exposure to the person infected with MERS-CoV. So the mortality rate is 35%. Treatment, no vaccine or specific treatment is currently available. So treatment is more for the supportive and based on the patient clinical condition. Okay, SARS coronavirus 2. SARS coronavirus 2 is the virus that causes a coronavirus disease 2019 or COVID-19. Okay, it can easily spread from person to person, from human to human, and then no immunity in humans. Until yesterday, there are actually 178 million cases worldwide, and then the death is more than 3 million. Almost touching the 4 million. The death and recovered 162 million. Okay, the origin is from bats to a mammal to human in December 2019. Pangolin used in Chinese, and then pangolin used in the Chinese medicine, probably linked to the seafood or exotic animal market, Wuhan wildlife market. Okay. Okay, a seafood market in Wuhan, China, the probable source of an outbreak of novel coronavirus of COVID-19. Okay, confirmed cases is a confirmed case is a suspect case with laboratory confirmed diagnostic evidence of SARS coronavirus 2 virus infection. Okay, method of transmission. So you can see that the SARS coronavirus 2 can spread from person to person. Okay, and then through the droplets made when infected people, cough, sneeze, or talk, and then through touching contaminated object or surfaces. Okay, the transmission incubation is 2 to 14 days, and then symptom onset from day 5 to 6 of the exposure. And then doubling time 6 to 7 days. High virus shedding occurs early in disease course, even those with mild symptom. And then prolonged shedding has been noted. Almost 1 month, especially in the feces, up to 23% of transmission due to pre-symptomatic cases in Shenzhen, China. Okay, transmission through the respiratory droplets, hand to mucous membrane contact, and then so especially through the eyes, nose, and mouth, and then variable for 3 days on solid. And then 24 hours for the cupboard, depending on temperature and humidity. 3 hours if aerosolized, airborne, likely not airborne with cough, but certainly possible with intubation, non-invasive positive pressure ventilation, high flow oxygen, and nebulizer and suctioning. And then fecal oral, virus shedding present in stool in diarrhea is common. Okay, incubation period. The incubation period is the time between exposure to a virus and the onset of the symptom. With COVID-19 symptom may show 2 to 14 days after exposure. CDC, Central Disease Control, Control of a Disease Center indicates that people are most contagious when they are in the most symptomatic. Several studies show people may be contagious before developing symptoms. And then, okay, SARS coronavirus 2 bind to the ACE2 receptor 10 to 20 times more than the SARS coronavirus. Okay, so these are the symptoms of the COVID-19. So you see they have this is mild symptom like fever, cough, and then shortness of breath, and then the other symptoms may include sore throat, running or stuffy nose, body ache, headache, chills, fatigue, gastrointestinal symptoms such as diarrhea and nausea, and then loss of smell and taste. The more severe symptoms can observe in difficulty breathing or shortness of breath, persistent pain or pressure in the chest, septic shock, new confusion or inability to arouse, and then bluish lips or face. So risk condition, people aged more than 60 years old, hypertension, diabetes, coronary heart disease, hepatitis B patient, cerebrovascular disease, chronic obstructive pulmonary disease or COPD. For example, chronic bronchitis, cancer, children and pregnant women seems to do okay so far. Okay, diagnosis, travel history, exposure and symptom most important. Person under investigation criteria, no specific physical exam findings. Lung may have a raised or harsh sound. Hypoxia may be presence, tachycardia, and then tachypnea, and then may presence as severe asthma or chronic obstructive COPD. Okay, testing RT-PCR from using the nasal or oropharyngeal swab. Okay, and then so this is the RT-PCR, 60 to 80% the sensitivity. Okay, treatment, mild or moderate symptom. Normally 80% of the patient with mild or moderate symptom. So normally this one is more to outpatient management of symptom and isolation, and then using oxytetracycline Tylenol, cough and for the cough and cold medications, and then need to protect family members, at least 2 weeks isolation. Okay, and then treatment. So for moderate with risk, severe critical symptom, about 15 to 20% with the moderate or severe symptom, inpatient management and supportive care, remdesivir and dexamethasone can be considered for patients who are hospitalized and require supplementary oxygen, and then oxygen supply by nasal cannula, and then also kalau the disease to progress, so have to use high flow non-rebreather oxygen, and then acute respiratory distress syndrome, control early intubation with airways pressure release ventilation. Okay, management of epidemic prevention, safe public health practices, especially using wash using sanitizer and IPC, infection prevention and control measures. And then so vaccination is very, very crucial, because vaccination triggers the immune system, leading to the production of neutralizing antibodies against SARS coronavirus 2, so that from there we can have the herd immunity. If let's say more than 60% people vaccinated, so we hope that we can get this herd immunity soon worldwide. Okay, and then containment, isolation of sick person, control contact tracing, quarantine of exposed person, and then mitigation, non-pharmaceutical intervention like personal hand hygiene, cover cough, stay away from sick person, avoid face, and then social distancing. Okay, and then for the environmental, have to use cleaning measures. So conclusion and future perspective, the increased intrusion of human into wildlife habitats and overcrowding of different wildlife species in wet market and farms have facilitated the interspecies transmission between different animal species, especially in the emergence of zoonotic viruses of the public health concern. So little is known about the replication and pathogenesis of these bat and wildlife viruses. So all the future research should be focused on the ecology, molecular mechanism, and biological properties of these viruses. So we hope that this will help in the prevention and control of emerging SARS-like or MERS-like diseases in the future. So currently no clinical treatment or prevention strategies are available for any human coronaviruses. So more research on the development of effective vaccine and antiviral. So these are all my references that I use in this presentation. Okay, that's all for my presentation. Thank you.
Thank you very much, Prof. Maizan, for your informative presentation. Yeah, unfortunately, due to the limited time, so we have to end the presentation.
Sorry, Doctor.
It's okay, Prof. Really informative and insightful presentations.
Okay.
Prof, actually, we have several questions, but I already offer you, right, that we will, all the questions will be kept, yeah, and then will be answered at the Q&A session after all the presentations have been performed. Is it okay, Prof? Okay. Thank you, Prof. Okay. Thank you very much once again to Prof. Maizan. And now we come to the next lectures. For the next lectures, the topic is important bacterial disease in veterinary medicine, economical impact, and animal welfare. That will be delivered by Dr. Intan Nur Aina Kamaruzaman. But before that, I would like to read briefly of her CV. So currently, Dr. Intan is a senior lecturer at the Department of Paraclinical Faculty of Veterinary Medicine, University Kelantan, Malaysia. And for academic backgrounds, Dr. Intan graduated from Para Matriculation College in the field of biology in 2009. And then she graduated with Doctor of Veterinary Medicine in 2014 from University Malaysia Kelantan. And then she continued her postgraduate study at the University of Liverpool, England, receiving Doctor of Philosophy in Infection and Global Health in 2019. And Dr. Intan research interest is in bacterial diseases, zoonotic diseases, bioinformatics, and molecular biology. And Dr. Intan has received many awards throughout her career as a lecturer and professional, and she also produced many international scientific journals and proceedings in related fields, and she's also active as a membership of professional societies such as a member of Active Fact Network, University of Birmingham, Malaysian Veterinary Council, Malaysian Association of Veterinary Pathology. Okay, that's the CV of Dr. Intan. Hello, Dr. Intan.
Hello, hi, Dr.
Hi,
Ann.
Dr. Intan. How
Yeah,
are
can you?
you?
I'm good. Finally get to meet face to face virtually.
Yeah, face to face, even though only by online. Yeah, once again, thank you
Yes.
very much, Dr. Intan, for accepting our invitations and
Yeah,
for
very
sharing this
welcome.
knowledge.
All right, all right.
Okay, so Doctor, are you ready to present your?
Yes, I will present my slide now.
Okay, Doctor. Your time for presentation is 90 minutes.
Okay, all right.
Okay, thank you. The time is yours.
So, can you see the slide? Is it coming up now?
Not yet. Yeah, still loading. Yes, we.
Okay, is it now in the presentation mode?
Yes. Oh no, not yet. Yes.
Oh, okay.
Now already. Yeah, now already. Yes.
Okay, so I'll start now. So, Assalamualaikum and selamat sore to everyone who attending this talk. I hope everyone is staying safe. My name is Intan Noraina binti Kamaruzaman, and I know Intan is quite a common name in Indonesia, right, Dr. N?
Yes, very common.
Yes, it is common in Malaysia as well. And I am a senior lecturer at the Faculty of Veterinary Medicine, UMK, the same place as the previous speaker, Dr. Maizan, who is also my colleague. And today I will talk about the important bacterial disease in veterinary medicine, which include the economic impact and animal welfare. First off, I would like to apologize because language is not really my forte, although I'm a Malay speaker, but I don't really speak Indonesian. There are probably some terms that you might find it very confusing, and I find it really confusing as well. But if you want to ask me in Indonesia or in English in the chat box, you're welcome to do so. I'll try my best to answer. Okay, so and then I would like to say thank you to the Universitas Airlangga for this opportunity, especially to the Dean and to the Vice Dean, Dr. Rimayanti, who I happen to, she went to UMK previously, right? But I didn't manage to see her because I was in UK. Also to Dr. Vivek Tiasningsi, and also to Dr. Yulian for this exclusive opportunity. And although we get to meet virtually, I hope after the pandemic is over, I will be able to get to Universitas Airlangga so that I can see everyone, and we get to, have some sort of like fruitful collaboration with regards to many aspects and education.
It will be our great
research.
pleasure.
Yes. Okay. All right. Right. So this is a bit of introduction about me. Dr. Ann has already briefed about myself. I just want to say I was born and raised in Kuala Lumpur, Malaysia, and I got my degree, a bachelor degree at UMK, as previously mentioned by Dr. Maizan. I'm currently the alumni. I was the first batch, and I was also a trained small animal clinician for 1 year after graduation. And in 2016, I secured a government full scholarship to study my PhD at University of Liverpool Schools of Veterinary Science in the UK, and finished December 2019. And coming back, I was appointed as a senior lecturer, and currently I am the head of Microbiology Laboratory in VDSU UMK. All right. I'm just going to skip this slide because Dr. Maizan has already briefed to you. So this is where we are. It's about an hour flight from Kuala Lumpur. And the good thing about in Kelantan, we have a very nice food. In the Northeast, this is they are considered as food paradise. So if you happen to manage to go to Kelantan after the pandemic, please try all these delicacies. They are very cheap. They are very nice, and you will never forget the taste of it once you dip your your teeth on it. Okay. Right, I'm just gonna skip to this. This is our chancellor and the vice chancellor. Okay, skip that. And currently, this is our faculty, as being mentioned by Dr. Mason just now. We are located at the city center campus, but then our hospital or our clinic, it's in another campus, which is about an hour drive from the main campus. Right, so this is our current final year batch. They are due to be graduated hopefully this year, despite all the struggles that we have during this pandemic time. Everything has to move online, but we lecturers we are trying our best to to cater the students' needs and also to keep our program up and running. And they are now very nice in their lab coat. And currently, this is our 4th year who will be graduating next year. So they are wearing our official scrub suit. Okay, and then, right. And then at the moment, we have about 200-ish students, okay, consisting from 1st year to the final year. So when they get into the clinical year, so we have 7 rotations consisting small animal medicine and surgery, pathology, ruminant, equine, poultry, and also swine practice. And these are some of the activities that the students do in the clinic. In small animal, the students can observe and also do some hands-on on cases. And also they are part of the surgery team. They're assisting the surgeon to do surgery. This is to give them exposure. Okay, this is me doing surgeries many months back. And then this is our students putting in a cat in the ward for to observe for the recovery. And then apart from small animal, we also bring students to the farm. For example, we bring students to the poultry farm, broiler, duck farm, okay? From the farm, the students can learn about the management, disease diagnosis, and we always bring back the carcass to the postmortem. So every student has the chance to hands-on to do a proper postmortem so that they would know how to diagnose the disease very clearly. So this is Dr. Farhan. I think you've seen him before. He's very popular in our faculty. And he is also the head of poultry medicine in our faculty. And about the postmortem, we don't always do postmortem in chicken, but we always do a postmortem in different species as well. We do ruminant postmortem sometimes on the site at the farm. And if the carcass is small, we bring it back to the lab so that we'll do the postmortem. And after that, we do a postmortem in small animals such as dogs and cats, sometimes in our lab. Okay, and this is the pictures of students' activity during the large ruminant rotation. So we have the students, we bring them to a goat farm so that the students can learn how to restrain the animal, to administer drugs, to advise the client with the clinician supervision, and also to take sample and then bring the samples back for future diagnosis. And we do the same thing with equine as well. Okay, aside from the clinical practice, the students, particularly the final year student, they are also exposed with the final year research project. This is a part of the curriculum headed by Dr. Maizan just now. And this is some of the examples that the students do. These two are my students. What we do this year is that we went to the nearest wet market. At night, we trap the rodents, we bring it back to the postmortem, and after that, we harvest the relevant organs, we bring back to the laboratory to check for molecular diagnosis. For my project is for leptospira. So the aim of the students for the project is we want them to be exposed the research world, and in case if they want to pursue to higher education, such as going for master or PhD, this is the necessary training that they should go and they should know. Okay, aside from the curriculum, our students also active extracurricularly. Currently, we have 3 clubs, students club and association. The first one we have VETSA, Veterinary Student Association. This is the oldest one we have, established since 2009. And the next association, this association links with the veterinary school all over the world. We have the international linkages, and the next one is the newest one is the UMK Health Club student. The good thing about having the clubs and association, not just the student gets benefit from the lectures, but they also get to lead the society and to prepare them to, to work one day because they need to lead an organization. So that's the good thing about joining the association. And all of these associations, they are being managed and led by the students. Before the pandemic, we have lots of other interesting activities, but since the pandemic, most of these activities are postponed or they are moved online. So if you've got time, please check on the Instagram on those activities. It's very interesting. And if one day Universitas Airlangga Siswa wanted to come to UMK and do some sort of like knowledge exchange with our students, or we come to you, we welcome for such collaboration. Just contact the students in charge, the president, and they will happy to assist you with that. Okay, that's all for the introduction. So let us begin with the lecture. This is a very short and sweet lecture. It's not really heavy, so I can assure you this is okay. Okay, it's not really that heavy. So today, the content of my lecture will be the introduction of bacteria, major bacterial disease in animals, followed by economic impact, responsibility of veterinarian, and also I'm going to wrap everything with a single conclusion. Okay, so as you all know, bacteria, they are prokaryotic. They live all around us. They live in the environment. They even common cell in human and animal. Those bacteria, they like to sit in the nose, stomach, gut, skin, vagina, and mouth and throat. And accordingly, there are about 99% of these bacterial species that are benevolent. Benevolent means they do not cause anything. They just mind their own business. They do not cause any disease. But just over 1% of the bacterial species that actually causing disease in living organism, including human and animal. So this particular 1% that we want to talk in our lecture today. And the common misconception about bacteria, not all of bacteria are bad. As I mentioned before, 99% are benevolent. So if you talk to a school children or the children about bacteria, they would definitely say bacteria is a bad thing. No, it's not true. It's not true at all, because bacteria, they are good because they help to process some of the important mechanism or biomechanism in our life. Okay, so for the good bacteria, we call this as probiotic. It is important because they help in digestion. Some of these bacteria, they're able to break down certain amino acids, which are essential in our life. And then they help to protect cells in intestine from invading pathogens. They help to promote damaged tissue, improve the immune system. For all you must know, the immune system comes from 80%, if I'm not mistaken, 80% of the good immune system comes from the healthy gastrointestinal tract or gut. And lastly, good bacteria, what they do is they compete with bad bacteria so that they won't cause this. So on how you're going to get this probiotic is by eating all of this superfood here. I'm pretty sure all Indonesian students know what is this. This is tempeh, it's a staple food in Indonesia, and we eat them in Malaysia as well. Then we can get the probiotics from cheese, yogurts, and also pickles. But when we talk about this 1% of bad bacteria, which we also know as pathogens, they can cause disease and discomfort to animals. They have a tendency to be transmitted to other species, including to human. We call it zoonotic. They can impair psychological and reduce the quality of life. As you can see the pictures in here, the cattle is very skinny and they look very depressed. It's because it's not well. And then bad bacteria can cause production losses in animals, particularly in livestock. They can cause abortion. Okay, this is a cute baby calf died as a result of abortion, and they can also reduce the milk production per se, and this will eventually have a negative impact for the economy. And if the disease or the bad bacteria is overwhelming, chronically infecting the animal, it can cause death to the animal and to human as well. Right, so this is a major list of bacteria species in veterinary medicine. I'm pretty sure everyone has seen this, has learned about it, and I'm not to cover everything. I'm just going to cover some species that I feel really, really important. And before that, let me introduce to you to our Department of Veterinary Services Malaysia. So this department is responsible to govern all the veterinary affairs in the country. And this person here, Dr. Nolizan, he is the Chief Director of our DVS. And I think starting last year, they releases this buku panduan, or known as the guideline, that listed all the notifiable diseases that needs to be reported to the DVS. So at the moment, we have 121 diseases, of which 40 of them are from bacterial origins, about 33%. And all veterinarians, pet owners, and livestock, they are required to report all of these listed diseases to DVS, which is required by law, so that they will come and do the investigation, and hopefully they would come up with a mitigation strategy to prevent the disease, to contain the disease, and to prevent the spread to different parts of the country. So I'm going to go to the first bacteria, which is very common. I'm sure all of us have heard about this. This is Staphylococcus. Okay, Staphylococcus, they are gram-positive. They look like grape under the microscope. This is how they look like. They arrange in irregular clusters, and they are commensal and can be opportunistic as well. And about Staphylococcus species, they can cause suppurative fission. And actually, there's a lot of Staphylococcus species that are being isolated and discovered. And the way to set them apart is we do a different set of biochemical tests. They have biochemical profiles. This would help for identification. And among all the 100 Staphylococcus species, don't remember everything, just remember these 3 Staphylococcus, which is Staphylococcus aureus, Hyacus, and Intermediacus. Right. So Staphylococcus, what they do in animal, it can cause several superficial disease. For example, it can cause mastitis, which is the inflammation of the udder of the cow. So whenever they infect the cow, it can cause severe milk loss. Okay. And in chicken, they can cause bumblefoot. So in mostly poultry, if they have this condition, it will reduces the carcass quality of a chicken, and the chicken won't be able to sell at higher price because of the condition. And in pigs, particularly this Staphylococcus hyacus, it can cause specific disease, or also known as exudative epidermatitis, which is a very fatal disease in piglets. And lastly, it can cause otitis externa in small animal, which is the inflammation of the external ear. So what seems to be a very simple infection for Staphylococcus aureus, what is the thing that we are worried the most is that Staphylococcus has the increasing trends of antibiotic resistance. This particular study, they tested in using 3 different bacteria, and they isolated from different animal products, and they found out that Staphylococcus aureus has the most resistant towards several antibiotics. So this is something that we are worried about, because eventually, if we not look after this problem, the Staphylococcus resistant species will find a way to get into our food chain, and eventually it will be distributed to our communities, to our environment, our livestock, and eventually to human. And this is very bad, because if let's say if this cycle continues, then in the future we might be having a problem to treat simple infection coming from resistant Staphylococcus aureus, which is not good. We need more antibiotic. We need to discover more antibiotic for that. Okay, next is Streptococcus species. Okay, this is very common as well. They are gram-positive. Instead of cluster appearance, they appear as chain-like appearance. This is how they look like under microscope. And similar to Staphylococcus now, they can occur as commensal on mucous membrane, and also can cause pyogenic infection. Pyogenic infection means they can produce pus-like lesion upon infection. And actually, Streptococcus species, they are primary pathogens in human. They can cause scarlet fever, and they can also cause pneumonia. But in vets, they can cause several diseases as listed here, such as mastitis caused by the families of Streptococcus, Pyogenes agalactase, Dysgalactia hybris. It can cause strangles in horse, and lastly, septicemia in pigs and piglets particularly. Okay, now I'm going to go to Corynebacterium. So Corynebacterium is a very important species. We see this bacteria every now and then because in Malaysia, it is commonly associated with caseous lymphadenitis in small ruminant, or we call it SELA. So, but these bacteria, they are gram-positive as well. They are polymorphic, which means they can exist in various size and shape. They are commensal in mucous membrane, but then they'll be able to survive in the environment. And actually, there's a lot of species, but the most important ones, they are Corynebacterium tuberculosis, Corynebacterium bovis, and renale. And similar to Staphylococcus and strep just now, it can also cause pyogenic or pus infection. And these are the common hosts that the Corynebacterium can infect. And for CLA, this is very common. I think it is common in Indonesia as well. Okay. I think so, because it's everywhere. It's present around the world. It is characterized by chronic suppurative condition. Why we call it a chronic? Because this infection normally has long incubation period between 3 to 6 months. And normally the animals that have this disease, they do not show any clinical sign unless you see there's a bulging of the lymph node here. Okay, this is the clinical sign of this clinical sign, which is enlarged lymph node. And if you cut open, there is an encapsulated abscess, as you can see in here. And this is what we call the superficial form. And CLA is also can be exist in a systemic form, which means it has the pus in the internal organ. As you can see from this picture, they got a pus in the liver. And in Malaysia, this is one of the notifiable disease. So if both forms are found in a single animal, for example, if this goat has got two forms, superficial and systemic, the carcass cannot be consumed and it must be disposed immediately. This is what we call total condemnation. We cannot eat this. And fortunately, there are available CLA vaccines, as you can see in here, Glenvac. However, I'm not sure whether it is widely practiced in Malaysia. So I'm going to go now for Bacillus. Am I speaking too fast, or are you okay with my speed? Hello.
Yes, doctor. I think it is too fast. I'm sorry.
Okay. All right. I try to tone down. Okay. Now.
Okay, doctor. Thank you.
Okay. Now we go for Bacillus species. Okay. Bacillus species, they are gram-positive, and they are rods gram-positive. And the interesting thing about Bacillus, they can form endospore. So this endospore means they're forming a spore inside the bacteria, which if they produce the endospore, they can survive in the environment for many years. Okay, and they are highly resistant towards harsh temperature and also harsh weather. Most of the Bacillus species, they are non-pathogenic. Actually, there's lots of them, but do not worry, they are not pathogenic, except we need to be careful with three of these species here. The first one is Bacillus anthracis. In human, in animal, we call it as anthrax. Okay, this is a very acute septicemic disease. The animal who suffer from anthrax, they will die less than 24 hours, characterized by bloody orifices. There's a blood coming from the nose, from the eye, from the ear. Okay, that is the most common characteristic. And as I mentioned before, it affects most mammalian species, including human. It is highly zoonotic, and normally human gets anthrax through the inhalation of the spore. Okay, and as I mentioned before, because they have the endospore, therefore they can survive for a longer period of time in the environment. So let's say if you go out and practice, if you feel like there's a case of anthrax, do not open the carcass, because once they get exposed to the oxygen, they will become a spore, and when you inhaled it, you will get anthrax. Okay, and the most ideal ways to dispose the carcass is by burn the carcass into the ground so that the endospore will die with them as well. Okay, that's for anthrax. So far, we have never seen anthrax in Malaysia. Hope keep it that way. But if it is found positive, then we need to alert the Department of Veterinary Service. Okay. Secondly, is Bacillus cereus. So Bacillus cereus is common cell bacteria in the soil, often associated with food poisoning in human by consuming contaminated meat and milk. This is one of the public health concern for food safety. And lastly is Bacillus licheniformis, which is also the common cell bacteria in the soil, often associated with food spoilage or pasture or silage spoilage, and it is normally caused for the abortion in ruminants. So ignore the rest of the Bacillus species, just remember these three. Okay, now we're coming to a Clostridium family. Okay, Clostridium family, they are very interesting because they are the only popular gram-positive that anaerobic. Anaerobic means they hate oxygen. When they see oxygen, they will become spore. They will never germinate if there is a presence of oxygen. And then normally Clostridium is present in the GIT of the animals or the alimentary tract of animals, which can be in common cell and opportunistic form. The bad thing about Clostridium, they induce potent toxin, and the toxin can be classified into 4 groups. I will explain after this. And Clostridium species able to infect all mammalian species, and so far we have about 20 pathogenic species. So, okay, as I mentioned before, Clostridium toxin, we classify them according to the toxin they produce. The first one, we have neurotoxin. So the name itself can tell you that the toxin affects the nervous system, and it is always characterized by muscle paralysis. And there's 2 important species for Clostridium neurotoxin producing Clostridia, which is Clostridium tetani. This is how they look like under the microscope, and Clostridium botulinum. Both of them can cause fatal intoxication. And horse are human, we are very, very susceptible. So once we get exposed to this Clostridium, the lesion will be too apparent, will be too obvious, and if you don't get the treatment as soon as possible, it can cause a fatal outcome. Human and animal may die. Normally, if the human or horse are infected by Clostridium tetani, especially, the most common clinical sign we can see is the tonic muscle spasm. So we're going to look into the clinical sign after this slide. And fortunately, we have the antitoxin available for Clostridium tetani. For example, if you are being bitten by a cat, or if you are being bitten by a dog and also exposed with a sharp object, you need to get the ATT within less than 24 hours, because once they produce the toxin, this antitoxin won't be able to reverse the effect. Okay, so the treatment would be very rapid. Okay, as for the Clostridium botulinum, I'm not sure whether we have this antitoxin available for botulinum, but normally Clostridium botulinum is always associated with improper food preservative technique, for example, canning. Okay, right. So for the histotoxin, as the name implies, these Clostridia producing species, they will directly cause tissue injury, particularly Clostridium chavoi. Okay, Clostridium chavoi will cause black leg disease in ruminant, and also the rest of the Clostridium here. Okay, it can cause a malignant edema or myositis, necrotic enteritis, and necrotizing enterocolitis. Normally, this is in pigs. And for the Clostridium producing toxin number 3 is enterotoxin, and the name itself, you know that it has a direct effect on the intestine. It can cause enteritis. Normally, Clostridium perfringens type A and E are the ones that can cause enteritis. This is very important in poultry. They can cause necrotic enteritis, pulpy kidney and lamb dysentery in small ruminants. Again, and lastly is another classification of Clostridium that produces multiple toxins at the same time, which can cause enteritis and multiple organ injury. For example, we have Clostridium cholinum, which is very common in quail, causing nephrotic enteritis, and Tietze disease in human, which is caused by Clostridium difficile. Okay. As I mentioned before, Clostridium can infect many hosts. For us, human, horse, and also ruminant, the most common one is tetanus and botulism. So this is how they look like. If they be infected, you can see that the horse cannot retract the muscle. This is what we call a muscle spasm. Similar to this goat as well, he's suffering from what we call a muscle spasm or muscle tonic. And when they have this lesion, it's very impossible to reverse the reaction, and they will die probably within days, because I think less than 24 hours, because their muscle cannot, the respiratory muscle cannot contract, and the animal cannot breathe properly. And for the ruminant, several Clostridia will cause histotoxic. For example, this black leg, this picture shows you Clostridium chaavo infection causing black leg, and then it can cause pulpy kidney in ruminant, and also malignant edema. It's like a gaseous lesion on the surface of the subcut and the skin. And lastly, in poultry, particularly the Clostridium perfringens, it can cause necrotic enteritis, which is characterized by sudden death and high mortality in poultry. And between turkey, chicken, and quail, turkey is the most susceptible. And if you cut open the postmortem, you will see this corrugated pseudo membrane-like lesion on the on the intestine. I forgot the word. All right, next we go to Mycobacterium species. This one is one of the oldest bacteria ever existed on Earth. It is said that this bacteria has been on Earth for more than 3,000 years. And the reason why they are very flexible species is because they are very resistant. They can survive in various environments, various temperature, and various weather. And they able to be resistant towards antibiotics as well. So this is a common problem in developing countries such as India and Bangladesh. They still struggle with the infection of Mycobacterium, particularly for the tuberculosis. So for Mycobacterium, they are gram-positive, but they do not actually stain well under gram stain, because the microleic acid that existed on the membrane will prevent them to stain properly. They require special staining, such as Zenilson. And then actually we have lots of Mycobacterium species, and most of the pathogenic ones, they are zoonotic, and they are very difficult to culture in the lab and to treat, because Mycobacterium causing chronic infection. And the reason why I said it's difficult to culture, because we need a spatial media, and they will grow on the agar for at least 6 weeks. So imagine if you put the plate in the lab, after 6 weeks, you open, you see that your agar will be dry, and there's a fungus grow instead of your Mycobacterium colony. That is very difficult. And then it needs to be in biosafety lab 3, because Mycobacterium is airborne. And Mycobacterium species of veterinary importance, it can cause 3 main lesions. The first one is tuberculosis. As the name implies, the tuberculosis will affect directly to the respiratory system, and the most common ones are tuberculosis in human, bovis, Mycobacterium avium complex, and marinum. And the fact about this species, they able to infect a broad range of hosts, from human to fish, opossum to birds. So you name it, they are able to infect. And actually, this is a common problem in a developing country. And in Malaysia, not much of a case heard about TB, because the government make it compulsory for children at the age of more than 12 years to receive a BCG vaccination that would somehow trigger the immune system that will protect to protect for a lifetime. Okay. And secondly, we have the leprosy-causing species. This is characterized by chronic skin infection, which is caused by Mycobacterium leprae and Lepremarium. And again, it can infect various species from human, cats, chimpanzee, rats, and also armadillo. And lastly, it can cause paratuberculosis, which is infected by Mycobacterium avium subspecies tuberculosis. In ruminant, it can cause Johne's disease, which is characterized by chronic diarrhea and chronic enteritis. And it is also said that it can cause zoonotic infection as well to human. They call it as a Crohn disease. Okay, next we go to Enterobacteriaceae. This is very typical bacteria. You can see they are easy to grow. They are present everywhere, and mostly they are common cell at the GI tracts of us human and animal. So they are gram-negative, rod-shaped bacteria, and they can be present everywhere, and they can contaminate the environment. Actually, Enterobacteriaceae, I divided the pathogens into two main types. We have the major pathogens and opportunistic pathogen. So opportunistic means that they would cause disease whenever they have a chance to do it, particularly causing the secondary infection. And the major pathogens, we have three star player. We have first E. coli. So E. coli can be divided into three classes. We have the class that can cause enteric disease causing by multiple pathotypes. The ETAC, it's like enterotoxicogenic E. coli, enteropathogenic E. coli. So, okay, just ignore about it. But all you need to know, all different pathotypes, they would produce different disease. For example, the enteric E. coli, they can cause diarrhea, malabsorption, and hemorrhagic colitis in human and also in some animals. And for the septicemia type, it can cause polysepticemia, which is very important in poultry and also in pigs. And lastly, the non-enteric E. coli, it can cause other lesion apart from the gut. It can cause urinary tract infection, mastitis, pyometra, and also oncolytis. Okay, the second star player of the Enterobacteriaceae is Salmonella. So Salmonella, actually, there's more than 2,500 serotypes available, but I only covered those are important in animals. For example, we have Salmonella serotypes, Typhimurium and Enteritidis. They are normally present in poultry. They are the carriers, so they don't show much of a clinical sign, but it is always associated with foodborne poisoning in human. And secondly, we have Salmonella serotype Polarum and also Salmonella gallinarum, which can cause Polarum and typhoid disease in chickens. And lastly, Salmonella cholera suis, which can cause enterocolitis and septicemia in pigs. And lastly, Yersinia species, if this is like more than 500 years ago, Yersinia will be the most deadliest one because it is related to bubonic plague. But now no more. Easily treated because we have the antibiotic, but they can also become enteric pathogens because they can cause enteric infections in animals. So these are all kinds of animals that Enterobacteriaceae like to sit. But as I mentioned before, they can also present in the environment. For opportunistic pathogens, normally we have Proteus, Klebsiella, Enterobacter, and others. Normally, they hardly cause primary infection. There would always be a secondary infection, and some of the diseases that they produce, such as coliform mastitis, UTI, and otitis externa. And bear in mind, all of these Enterobacteriaceae in animals, they are normal, but as I mentioned before, they can cause or always associated with foodborne poisoning in human. For example, this is the cut section of the newspaper. It says that one of the Malaysian food, so laksa, it was poisoned by Salmonella bacteria. I think these were like 2 years or 1 year ago. I don't remember. So it resulted into fatalities, and the stall that sells the laksa has to be suspended because they found that maybe the unhygienic preparation of the food, also the food is not being cooked properly, not enough temperature would cause salmonella to be retained in the food and infecting others. And the next one is also a cut section of food poisoning cases reported in Malaysia. It's like it says that the guests who attended the wedding ate this ayam, chicken, and it was poisoned. I mean, it was contaminated with bacteria, causing 4 deaths and hundreds poisoned ended up in the hospital. Okay, now I move to Pasteurella and Mehemia homiletica. This is obligate respiratory pathogens. They are different in terms of biochemical and also morphologically. Okay, and as a main characteristic, they are gram-negative small bacilli. They are commensal in upper respiratory tract, and most of the disease caused by Pasteurella and homiletica, they are triggered by stress. And this is how we see Pasteurella under the microscope. They normally have bipolar staining if you stain them using Ginchester stain, and in livestock, it is considered as major respiratory disease. Actually, Pasteurella is present in most species, but ignore the rest, only remember 3 major ones. The major species that we have is Pasteurella maltosida, Mehemia homiletica, and Pasteurella trihalosea. So for Pasteurella maltosida, we have type A until type E. We don't have type C, A and E. And then in Malaysia, we normally see hemorrhagic septicemia or HS, which is very common. It is acute fetal septicemia in cattle and buffaloes. And normally, as I mentioned before, it is always triggered by stress, such as changing of weather, poor body conformation, and overwork. And it is very susceptible to buffalo compared to cattle. Okay, and we also have type A, which can cause atrophic rhinitis, shipping fever, and fall cholera in chicken. And this is characterized by sudden death in chicken. And when we cut open the postmortem, during the postmortem, we always see hemorrhage on the serous surface and body fluid on the body cavities. As for the Mehemia homiletica, this is very common in small ruminants. It can cause shipping fever and then pneumonia. And lastly, Pasteurella trihalosea, we actually never came across this before, but it is another pathogenic species that can cause septicemia in ruminants. Okay, as for in pigs, Pasteurella maltosida can cause atrophic rhinitis, which when they got infected, it will alter the appearance of the snout of the pigs, and it is often co-infected or having concurrent infection is Bordetella bronchoseptica, which eventually cause pneumonia in piglets. But the good things about hemorrhagic septicemia, fall cholera, and atrophic rhinitis, we all have the vaccines available. But again, I'm not sure how frequent the vaccination being practiced in Malaysia for this particular type. I would like to share to you a story about this picture. So this is the picture of the kid with his buffalo. So he has a buffalo farm with his father. So when a photographer came and took his picture playing with buffalo, and he submitted it to international competition. This picture won, and the kid and dad has become instant celebrity overnight. A lot of people come to their farm to take pictures with this kid playing with the buffalo and all. But just over last year, the same farm has got a HS outbreak, and it has resulted more than 60 buffalo in his farm died. This is very sad. The reason why they have this outbreak is because I think because of the weather change, and all of the animals in this farm, they were not vaccinated. So this is actually quite sad and quite bad because we know that this disease is easily prevented if they give vaccines. Right, now we go to Brucella. So Brucella is a very important species in Malaysia. We have them every year. It's very, very hard to eradicate it because most of the time the animals that have Brucella, they tend not to show the clinical sign unless if they are pregnant. Okay, it's very hard to see whether they're okay or not. Okay, Brucella, they are gram-negative, small coccobacilli, similar to Mycobacterium. They require acid stain, such as the Zinn-Nielsen stain, to be able to visualize them under the microscope. Brucella can equally infect male and female animals, and it is highly zoonotic to human, causing systemic infection. We do have those cases in Malaysia, and as I mentioned before, they do not tend to show clinical signs, but once they get infected, they become a carrier for life. Okay, Brucella, the species sound is very specific because in cattle, normally Brucella abortus will infect the cattle. In pigs, we have Brucella suis, Brucella malatensis in small ruminants, Brucella canis in dogs, and Brucella ovis in sheep. But then, regardless the name of the species, all of the species, they have the same clinical sign and the same clinical manifestations, such as abortion, orchitis, infertility, spondylitis. All of this will infect the reproductive system of the animal. And in human, it can cause intermittent fever and mild systemic disease. And the one that we most worry about is bovine brucellosis. Also in the UK, they call it as Banff disease. It is distributed worldwide, and the infection acquired by various routes, such as ingestion, venereal contact, inhalation, skin abrasion, and even this brucella can be transmitted to the mammary gland, and then eventually pass to the milk. So imagine if the human drink unpasteurized milk, they will be able to get brucella as well. And in cattle, it can cause abortion storm. Abortion storm means if the cattle are inseminated, herd of cattle are inseminated at the same time for them to get pregnant. And if they are being exposed to brucella, all of them can get aborted together. So that is meant by abortion storm. And then, as I mentioned before, it can cause decrease in fertility, milk production. And in Malaysia, this disease is pretty much looked after. We have the detect and call policy with compensation by the government. Again, I'm not sure, I'm not familiar with this compensation scheme. For all I know that we do offer some compensation to the farmers whose animals are badly infected with the brucella. And fortunately, we have vaccines available for brucella, such as RB51 and strain 19, but again, not sure of the practice in Malaysia. This is the sign of brucellosis. We have aborted fetus, and if you cut open the postmortem, this has to be done carefully because it can be transmitted to human through airborne. It normally in the postmortem we will see the edematous cotyledonary chorion, because brucella likes to sit inside here. The chorion, it contains the erythritol, is a growth factor for the brucella, so they like it so much. And as I mentioned before, we do have a human brucella case in Malaysia. This is a case report like years ago about the human brucellosis. The person himself working at the University Putra Malaysia, and the person himself got infected when handling the specimen. Okay, now we go to my most favorite bacteria. This is Leptospira. This is one of the most bacteria I haven't seen compared to other bacteria, and I spent 3 years studying my PhD on Leptospira. I can tell you all day about it, but I'm just going to simplify everything in one slide. So Leptospira, they are gram-negative spirochetes, okay? And they can infect a broad range of mammalian hosts, including human, and they can be divided into 3 types. We have the pathogenic, non-pathogenic, and the other one is intermediate species. They are present worldwide, and they can survive in the moist environment. And those Leptospira in livestock, when they infect this animal, it can cause major production losses. And all you need to know that Leptospira likes to be friends with the rodent in rats, so they coexist together, okay, without showing any clinical sign. Actually, there are about more than 250 pathogenic serovirus, but the most important ones, they are interrogans and Boxpeter-Sinii. And Leptospira can cause reproductive failure in cattle, swine, and also in the horse. It can cause milk drop syndrome. And again, same as brucella, this disease is difficult to be diagnosed because most of these animals, they tend not to show the clinical sign unless if they being infected with the pathogenic non-native seroba, then they will produce the sign. And same in swine, in pigs as well, it can cause reproductive failures, and it is a very fatal disease in piglets. If the piglets have been infected, the mortality will be 100%. They cannot survive from it. But still, we have available vaccine, and some of the swine commercial pig farms, they do vaccinate the animal against leptospira. And lastly, in horse, it can cause abortion, and depending on the species, if the animal is chronically infected, it can cause blindness. And lastly, in dogs, although dogs, they are carrier, but then they still be able to produce the lesion, especially when they are infected by non-native seroba, which can cause renal disease and hemorrhagic disease. And surprisingly, all of these clinical manifestation, they are the same as in the human. So if the dog has got renal disease, human will get it as well. Okay, and fortunately for dogs, we do have available vaccines. Normally the multivalent vaccine that will cover several serovars, and in Malaysia, this is one of the core vaccine that the dogs needs to be vaccinated against. Okay, interesting thing about leptospira, of all the 250 leptospiras found worldwide, I realized that some or most of the strain, they are originated from Indonesia, and they are actually named after someone's name, or after they are named after the place that they discovered, such as Javanica, I think this is in Java, Bangkinang, Samaranga, I think this is Samarang, Rasmat is a person name, and Batavia, I think is an old Jakarta name, I don't remember, and there are many more. This is to show to you that leptospira is already present in Indonesia for God knows for many years. So this is something that you can be proud about. Okay, I think the last bacteria will be the mycoplasma. So mycoplasma, it doesn't fall into the category of bacteria because they lack of cell walls. So we do not know whether they have gram-positive or gram-negative because they don't have any cell wall. But this is how they look like under the microscope. They appear as fried egg appearance, microcolonies, and they do not stain by normal gram staining method. They are host specific. They can be found on the microsurface of the respiratory and regenerative tracts, and in livestock, they will cause respiratory disease. Actually, there's a lot of mycoplasma species available, but I will only touch on two. The first one, mycoplasma in cats, which can cause feline infectious anemia. Normally, the cat has it because mycoplasma is transmitted by the flea, and once they bit the cat, it will travel to the blood and it will sit peripherally on the red blood cell and eventually cause cell rupture, and the infected cat may have anemia. As you can see, there's a jaundice in here and anemia. And those cats that has immunocompromised condition, for example, they are infected by feline leukemia virus, they can cause death as well. And the next one is mycoplasma in poultry. We've seen this case every now and then. It can cause chronic respiratory disease caused by Mycoplasma gallisepticans. Sorry, this is a wrong spelling, gallisepticans. And it is mostly infect the poultry, and it can cause bird respiratory damage in the bird's respiratory system, causing the respiratory distress. And where distress, when the chickens distress, they don't want to eat, it can result in poor production, and the infection is always complicated with secondary infection, especially to E. coli. So as you can see from this picture, this is the liver of the chickens. It is coated by the fibrin as a result of the secondary infection with E. coli. And the next picture is how they look like if they're being infected. They will have a swollen face. Okay, I think that's all about the disease that are important. So I already covered that. So let us look at the impact of the disease towards the economy. So imagine this is actually a global problem this day, particularly when there is an emergence of disease that can cause outbreak and if going to affect the global trading. The reason why we are concerned because those diseases, they can affect the human well-being, it can cause production losses, increased cost of treatment and prevention, and also it can have an effect with the animal welfare. However, mostly veterinary emerging disease, a lot of researchers, they focus much on the viral causes because viral causes, they can cause a major outbreak and then after some time they go. But for bacteria, it's very hard for us to trace because they are everywhere. They just being dormant, and suddenly when they are being, when they have the opportunity to cause infection, then they will cause infection to animal. So compared to viral disease and bacterial disease, viral disease is easy to estimate the economic impact, but not much of a bacterial disease. The reason why they are difficult to estimate is because, as I mentioned, they are largely present in the environment, and animals, they are carried to certain bacteria like Brucella and Leptospira. As I mentioned before, Brucella, you won't see the disease until they are pregnant, and for the Leptospira, you won't see them because they're just that they are the carrier for that. So it is hard to actually estimate the economic loss. And secondly, limited surveillance on underreported cases also become the factor is because we do not know the current prevalence of a certain disease, and therefore economic impact is hard to be estimated. And number three is sporadic outbreaks, which mean that sometimes the infection come and go at a wrong time, at a wrong place. So it's very hard for us to estimate the economic loss. And lastly, in many practice, they often use antibiotics for prophylaxis or for prevention, and this antibiotic somehow masking the lesion of the disease, unless if the antibiotics or the animals is not responding to antibiotics anymore. And these are all the contributing factor on why economic losses are difficult to estimate. But some of the economic impact of bacterial disease can be estimated when they are involving the industry. Okay, for example, we have the mastitis. Okay, this is the economical impact of mastitis. As I mentioned before, mastitis can be caused by many pathogens. We have E. coli, Staphylococcus, Streptococcus, and bovis. And according to this study, they said that every pathogens, they somehow affect the milk yield of the cattle on average. For example, for E. coli, they said that pure infection of E. coli in this cattle the cattle can lose 3.5 kilo milk per day, followed by Staph aureus, Streptococcus aureus, and C. bovis. Okay, and you need to think about the mastitis. How does the loss can be estimated, and how does it's going to affect in the dairy industry? For example, mastitis will reduce milk production. It can alter the taste and the color of the milk. And then the milk should be discarded if they are heavily contaminated. And then it can cause high replacement costs. High replacement cost means if the cattle having mastitis and they're unable to produce milk, so the farmer needs to replace with the new animals. So this is what it meant by high replacement cost. It can cause extra labor. It can increase the veterinary cost, and as well as veterinary service as well. So if you look into the annual loss of top dairy producing countries, it is recommended that USA suffer the most loss. Every year they lose about $2 billion, followed by Canada and lastly Australia. Okay, so this is the economic impact of mycoplasmosis. So mycoplasmosis is very important in poultry, and the losses due to poor feed conversion. As I mentioned just now, they have the respiratory distress, so they don't want to eat at all. And this causes a decline in sharp rate, weight gain. They can also reduce hatchability and chick viability. They can cause poor carcass quality because you see that the organs, they are all being covered by the fibrin layer, and they can cause high morbidity. And in layers, they can reduce egg numbers. And it is mentioned that mycoplasmosis is a worldwide problem, and the losses is about to be estimated million to $3 trillion annually. And this is because the prevention and control program for mycoplasmosis is very, very expensive. And mycoplasmosis is really very difficult to control because it can spread easily. Okay, number one. And as much as you put a good biosecurity in the farm, the mycoplasma always gets the way to get in. Okay, that's the biosecurity challenge. And we also be burdened with the increase of the evolution mycoplasma strain, which makes it really, really difficult to control. And lastly, some farms, particularly in the Western world, they would love to opt for antibiotic-free production system. So that is why mycoplasma love this practice, so they would prosper in the farm. Okay, the next one is the economic impact of brucellosis in animals. Okay, this is data taken from Malaysia. So brucellosis, again, the losses could be due to reproductive failures, culling of animal, and compensation by the authority, cost of treatment and prevention, and also reduced milk production. And the data that I got from Malaysia, the animal prevalence currently we have about 22%. This is old data. I don't have the current data now. And human prevalence is about 14%. And as I mentioned before, we have the culling policy by the Department of Veterinary Services, and they also offer compensation. But again, I'm not sure how much is the money being offered to the farmer. And every year they have this national eradication program with compensation scheme. They do a surveillance every year to determine the prevalence of brucellosis. And the DVS also, they encourage vaccination program to the farms, which is more than 3% serological reactor. And then it is estimated that the loss due to Boeing brucellosis in Peninsular Malaysia is about 1.5 million ringgit, which is probably about 400,000 USD, and estimation loss due to goat brucellosis in Peninsular Malaysia is about 8 million ringgit, which is about 2 million US dollar. And this figure, they are just the estimation, because if we were to combine the production loss of brucellosis in the entire nation, including those in East Malaysia, such as Sabah and Sarawak, the cost could be higher than this. Okay? And I managed to find that brucellosis is a very important disease in Indonesia as well. This study I managed to find, it is said that the farmers in Indonesia, they suffered somehow similar loss from what we have in Malaysia. And the annual estimation loss due to brucellosis, particularly affecting the meat cattle, dairy cattle, and buffalo, they are about 3.6 trillion rupiah, which is about $25 million. Okay, I'm not sure, just do the rough exchange on the internet. Okay, this is to show to you that obviously brucellosis can cause a detrimental effect towards the Indonesian livestock. Okay, the last one, I will talk about the economic impact of hemorrhagic septicemia in livestock. So the data I've taken is in India. Reason why I took India data is because India is one of the largest livestock producer in Asia. Even in Malaysia, we import a lot of buffalo meat and cattle meat for our consumption, is because we do not produce enough meat for Malaysian population consumption. So we import from India because they're cheap. And accordingly, HSH, or hemorrhagic septicemia, is one of the big businesses in India, because it can cause direct and indirect losses due to the mortality loss, means the animal died. Okay, that accounts for 96%. And milk drop, especially in dairy animal, growth retarded. Operational cost. Operational cost means the cost of feeding the animal, the cost to hire people to look after the animal when they are when the animal are sick, and also other related costs. Increased calving interval. Decreased work power means in India a lot of farmers use buffalo and cattle to plow the land as part of the traditional agricultural method. But when these animals succumb to HS, they cannot work, so that's why it will reduce the work power, and lastly, it will loss due to increased treatment costs. And then it is estimated losses of HS in India per animal. For cattle and buffalo, it is about 1 to 1.6 billion USD. So this is a very bad impact towards the economy. Right. So I already covered some of the disease and also the economic impact that are caused by bacterial disease. So what can we do as a veterinarian and you students as a future veterinarians? There's a lot of things that we can do in order to limit the spread of this disease to the animals and eventually will prevent the production losses. The first one, we need to report to the veterinary authorities on all notifiable diseases on outbreak. So we need to report to them so that they will come do the investigation and hopefully stop or contain the disease from spread to other parts of the country. And then it is always an ideal way, or it is a very warranted way to do extensive surveillance on underreported diseases, because this will tell us the current prevalence on certain bacterial disease, and eventually they can do something about it. They can estimate the economic impact as a result of that. And number 3 is the very important point, is we need to encourage the prudent use of antibiotics for treatment of prophylaxis. So the vet has the power to advise the owners or the clients of the animal to follow the antibiotics regime and to follow with the withdrawal period, because we want to slow down the antibiotic resistance. And as a veterinarian or future veterinarian, we need to always update the knowledge on veterinary science. We need to be always up to date, always be alert of the latest issue, and who knows that this issue is going to help you for further diagnosis and also to advise on the treatment. And as a veterinarian, we always have to adhere to the veterinary policy by the government. And lastly, we can use our knowledge to promote the awareness to farmers and also to pet owners with regard to the disease, so that it won't spread to other animal or to spread to human population. Right, so I'm going to wrap my lectures with a conclusion. So I've discussed about not all bacteria are bad, only just over 1% causing disease in animals and humans. And bacterial species in animals, they can affect productivity and welfare, and they have a tendency to spread to human. And economic estimation is difficult to determine, and they are only available on certain diseases that affect the livestock industry. And lastly, as a veterinarian, we must play an important role to prevent diseases to human and animals, and also to prevent further economic losses to the country. Okay, with that, I would like to end my talk with a brilliant quote from the former US President, Barack Obama. He said that change will not come if we wait for some other person or some other time. We are the ones we've been waiting for. We are the change that we seek. In another way, I mean to say is we are the veterinarians. We are the ones who can make a world a better place for us and a better place for animals. With that, thank you so much. I hope everyone enjoying the talk. Stay safe, and back to you, Dr. Anne.
Thank you very much, Dr. Intan, for the
thank you.
So, okay, we are now going to the Q&A session. So for all the students or for all the participants who have the questions, you can write your questions in the chat box, or you can ask directly to the speakers. But here, we have several questions in the chat box. So let me try to read from the first questions. Wait. Okay, so Okay, so for the first
And
question,
how do I unshare this thing?
sorry, Dr. Intan?
How do I unshare this thing? Do I still presenting the slide?
Oh, yes, you can stop to share.
Ah, okay, fine.
Yeah,
Okay.
ready.
Sorry.
Okay. It's
Sorry,
okay,
because we
doctor.
are not familiar with Zoom.
Yeah.
Okay.
Okay.
So,
So I will read for the first question. This question
Okay.
is for Professor Maizan.
Okay.
So this is from Dr. Saifur Rahman. He is asking about the dear respected Prof. I have a question about the current COVID-19 pandemic. What is the actual causative agent of this pandemic? And the second question from him is avian influenza virus and COVID-19 are similar in infection, or other similarities, or any other similarities in these two pandemics? Yeah, maybe you can answer the question first, Prof.
Okay, first question, what is the actual causative agent of this pandemic? So the disease is caused by the SARS coronavirus 2. Okay, so this is actually the novel coronavirus in human, transmitted from actually the actual source of this virus is bats. And then this is from the study confirmed by the study done by the Thailand group. Okay, they found that the virus from the bats that have the similarity in terms of the sequence of the virus lah with the COVID-19 virus, SARS coronavirus 2 in bats. But I think, if I'm not mistaken, about 98% sequence identity. So we can say that actually the source of the virus is from the bats, and then from the bats the virus goes to the bats, they goes to the pangolin. Okay, because the pangolin, because they found that the antibodies for SARS coronavirus 2 antibodies is quite prevalent in pangolin. So and then from the pangolin jump to the human. Okay, so and then they also found that actually all these SARS coronavirus 2 virus have can have the sequence for the receptor binding of the human, like ACE2. So that from there they concluded that this virus actually was from the bats to intermediate host pangolin and then to the human. Okay, and then is avian influenza virus and COVID-19 are similar in infection? Yes, they have similar infection. They have fever, they have sore throat, they have runny nose, all this. But the only difference is in influenza virus. The in terms of infection, they don't have the reported one, like breathing difficulties of the, especially with the common influenza virus yang cause seasonal flu. Okay. Okay, and then in terms of incubation period of the disease too, actually influenza virus is shorter lah for the incubation period. Okay, and then the other one is the similarity. Is aspirin.
Yeah, aspirin. Aspirin is effective in serum
if I'm not mistaken, aspirin is used to reduce the blood clot, because one of the implication of this COVID-19 in human, especially in the severe cases, they can cause blood clot. So they use this aspirin more to like thinning of the blood lah. Okay. So am I answering the question?
Yes, Doctor.
Okay, and then
now we have another question from Dr. Amir. So, respected Prof. Nadia, good morning. Your presentation is very knowledgeable. My question is that if 59 degrees Celsius, I think it is inactivated. Why not develop it inactivate vaccine?
Okay. Actually, if we use heating to inactivate the virus, same like we use kill vaccine actually, because kill vaccine normally being treated by using the chemical lah. Okay, but the problem is during heating, maybe some of the immunogenic components of the virus gone. Okay, for example, the spike protein. So that kalau let's say the immunogenic part of the protein loss, so that in term of protection to lower. But actually, you actually can hitting the virus to use as a vaccine can be used, but that you don't expect to have high protection with that. If we compare the kill vaccine with the mRNA vaccine or mRNA vaccine or vector vaccine, even the protection is lower with the kill vaccine. Okay, the protection normally between 60 to 50 to 70% only compared to the other vaccines of COVID-19. More than 90%, because some of the immunogenic part of the virus in the key vaccine to the loss, especially spike protein. Okay.
Okay. And then another question is from Professor Suwarno. I have two questions. The first question is why the coronavirus is so easy to mutate, and then. Where is the second question? Okay, maybe you can answer the first question first, Prof.
Okay, why coronavirus is easy to mutate? Because coronavirus is single-stranded RNA. So single-stranded, because especially the single-stranded RNA, they don't have the proofreading enzyme. Okay, so that when they mutate, and so no mechanism that can repair this mutation error, and then the virus keep on continuous with the mutation.
Okay.
Especially for the single-stranded RNA, the mutation is higher compared to the double-stranded RNA. Okay, any more question?
Yes, Prof. We have another question. Yes, Prof. It's very clear answer. And then we have another question from students. Hello, good morning, Professor. My name is Koristani. I have a question. Why do coronavirus mutate so fast and the mutation is more virulent than before? Thanks, Prof. I think you already answered this.
Yes, but it's okay. Actually, maybe I can answer a bit on this, because whether the new virus too can cause more severe disease or not, that's depend on the mutation of the part of the mutation lah. If let's say involved with spike protein mutation, and then because as we know, this spike protein is actually responsible in the virulence, virus virulence, all this, so that make the disease more severe. Okay.
Okay, and then the question from another student. Okay, Prof, I would like to ask some questions. Today, many countries do the vaccinations program of COVID-19 for a huge number of their populations, including Malaysia and Indonesia. So in news, we also knew that the coronaviruses. Sorry, Prof, it's difficult to open this. We also knew that the virus always mutation and create new variants. So it is possible the vaccination program that the government have done until today could have no effectiveness to prevent the infections of coronavirus. And if it is until the coronavirus variant stable, so we will always have to upgrade the vaccine and always have to be vaccinated.
Yes, we need to do that. Like the one that I mentioned for our infection bronchitis virus. Okay, so the current vaccine cannot protect our local strain of infection bronchitis virus. Same thing with this COVID-19 vaccine. But currently there are no reports lah regarding the current vaccine cannot protect the variants. The most variant COVID-19 SARS coronavirus 2 variant that we are afraid now is the one that Delta variants from the India, because they become more the infection rate is more, and then more virulence, all this. But so far, this the current vaccine can protect this variant, Delta variants. Okay.
Okay. Thank you very much for the answers. Very clear. So actually, we have several questions here. This is from Dr. Amir. What is the mutation rate of coronavirus, and is this mutation effect the efficacy of vaccine immunogenicity? If yes, so what is the future vaccine of SARS-CoV-2?
Sorry, wait. Sorry, where is the?
Wait. What is the mutation rate of the coronavirus, and is this mutation affect the efficacy of vaccine immunogenicity? If it is yes, so what is the future of SARS-CoV-2 vaccine?
Okay, so meaning that the WHO or CDC always need to monitor the variant strain of the virus, and then whether the current vaccine can protect or not this variant strain. If the current vaccine cannot protect, so we have the world need to produce new vaccine that can protect this. Or if not, if we don't have because it takes time for us to produce the vaccine. So if not, we have to try to use vaccine that contain all this vaccine strain, so that hopefully one of the vaccine can give protection to the current variant.
Okay, we have one more question to Prof. Maizan. This is the question from YouTube, Prof. So, Prof, would it be possible for a virus to mutate to a variant that is not virulent?
Yes, possible. So that's actually we hope that we hope for. So that the virus mutate, and then because actually whether the virus is virulent or not depending on the place of mutation, and also the changing of the amino acid on that they are involved with the mutation. So if the changing from the amino acid that can cause virulent strain to the less so we can. So we hope for that.
Yeah. Okay, and then we move to Dr. Intan. So the question is for Dr. Intan.
Yes.
Yeah, I have a questions about the Clostridium tetani and Clostridium botulinum. Which type is high fatality and more pathogenic, and why? And why dogs are less susceptible as compared to human and animals in case of Clostridium tetani?
Okay, I think the answer for there is no right or wrong. Okay, this is based on the research that they said that between Clostridium tetani and botulinum, both has a degree of high fertility, but the most common one being the Clostridium tetani, because Clostridium tetani, they are present everywhere in the environment. So a lot of cases reported more on Clostridium tetani instead of Clostridium botulinum. We always have the problem with Clostridium botulinum when someone ingested a canned food that is not properly preserved. Okay, and why dogs are less susceptible as compared to human? Okay, this is a very good question, because dog itself is a carrier for Clostridium. Okay, so at some point they be able to it's not getting immune, but because we don't carry it, the horse don't carry it as much as they are carrying on the gut. So I think this is the reason why dogs are less susceptible. Meaning to say that it's not that they cannot get the infection, they still can get infection if they being exposed to, say, to the deep penetrating wound. Clostridium can still produce the toxin and cause disease in dogs as well.
Okay, and then another question to Dr. Intan. So my question is that horse feces is a natural reservoir of Clostridium tetani, but why horse evac with Clostridium tetani as it is present in its gut? I don't know.
Okay. I've seen.
You got the question? Okay.
Yeah, I got the question, so I've read it.
Okay.
I think yes, correct. Clostridium tetani is one of the common cell in the horse. But then, if you think about the pathophysiology of the Clostridium, in guts they normally stays at the superficial. They don't sit at the deep tissue. So the horse will be very, very susceptible if they've been exposed to a deep penetrating wound. If they have a deep cut, and this is the place where Clostridium can migrate it and can produce toxin because they love to stay at the very deep tissue. Okay, as a result of wound puncture.
Okay, and then for the next question is about the HS, hemorrhagic septicemia.
Okay.
Hemorrhagic septicemia outbreak mostly occur in rainy season. This is when the neck muscle gets stiffness, it pressure on respiratory tract which cause death. But what type of toxin produced which cause stiffness of muscle, and is there any digestive signs in HS? Okay,
for the hemorrhagic septicemia, to be honest, each type of each type of Pastorella, they produce different kinds of toxins. For the most common one that I know of, maybe not related to the question, is the LPS, which is the endotoxin, and the other one being the dermanecrotic toxin. But the reason why it can cause muscle stiffness, I'm not sure. It could probably something to do with the postmortem changes, because HS is a very acute disease. And it's not human. The animal may die less than 24 hours. But whether or not the toxin can cause muscle neck stiffness, that one I'm particularly not sure of that. So sorry.
Okay, doctor. Okay, so we have another questions about brucella. From Dr. Amir, why brucella is not present in cats, and what is the immunogenic properties that not able?
Come again?
Why brucella is not present in cats? Yeah, it's not.
Okay.
Yeah. So what is the immunogenic properties that not able for brucella to affect the cats?
Okay. One thing about brucella, they like a chemical or the growing factor called erythritol, which is abundant in ruminants, like in cattle, in sheep, and in goat. But I don't think erythritol is present in cats. So I think that's the common answer why brucella were not unlikely to infect the cat, because they don't have the growth factor that they need to grow.
Okay. Oh, doctor, I have a private message and special question for you.
Yes, ask this question.
Let's ask this question to Dr. Intan. But can I mention the name here?
Of course.
Okay, so Dr. Intan, in your presentations, you have mentioned about the extensive surveillance on underreported diseases. So can you give some examples of underreported diseases that have impact on animal health and economy?
Underreported disease as in like in Malaysia or in worldwide?
Yes, I think in.
Okay, is it like in general?
Yeah, I think in general.
Okay, I think the most probable example that I would give is Mycoplasma. Mycoplasma is one of the very underrated disease, although it can cause a lot of problem, but this disease is always being overshadowed by other disease. And for example, another example would be leptospira. Even in Malaysia, although we know that leptospira can cause silent production, it can cause milk drop production in animal, but there's not much of the studies or surveillance being done to see whether the cattle in Malaysia do have leptospira or not. Because whenever we see abortion, whenever we see milk drop, we always say, oh, this is something else. This is could be Campylobacter, it could be other like Brucella that eventually cause a similar lesion. So this is one of the examples that I can give. It's pretty because people think that it's not important, but it is important. That's why it is not reported.
Okay, it's really answered the question, doctor, because he just messaged me and he asked about in general.
Okay, it's all right, it's all right.
Okay, so is there any questions more for all the participants? So you can, we still have time actually. So if for all the participants who have questions, so you can chat, you can write your question in the chat box, or you can ask directly to the speakers. Yeah, I have checked the chat box and there is no more question.
I think I can see one question asking why Brucella vaccine is not effective, and it is possible Brucella vaccine causes abortion in pregnant animals.
Oh, sorry, maybe I missed that question.
Okay, it's all right. To be honest, I don't have experience handling Brucella brucellosis before, so I think I cannot answer why. Is it possible whether the vaccine can cause abortion? But one of the things that I was thinking is if the animals having Brucella already and you vaccinate it, it won't be able to induce protection, because the aim of the vaccine is to trigger immune response, not after the animals being infected. So I think this is one of the reasons why we see a lot of vaccination failure in animals. But I'm not really sure. Can Brucella still infect the animals? Yeah, can Brucella vaccine can still cause abortion in pregnant? I'm not sure. I think it depends on what types of vaccine are you talking about. If you're talking about a kill vaccine, they are very safe for animals. They will unlikely to cause abortion. But if you're talking about live vaccine, there is a tendency for them to revert into virulence and can cause abortion. Okay, and I think the next question would be Brucella shed milk urine. What's this? Placenta and all discharge. If animal get brucellosis, how many abortion? I'm kind of confused with this question.
Which one, doctor?
The one with the milk, urine, I think it's semen, placenta and other discharge. Okay, okay, I think I kind of get the idea. So whenever, as I mentioned in my lecture before, whenever the animal is seropositive, having the infection with Brucella, it will reduce the fertility drastically. So if the animal gets pregnant, it gets aborted, pregnant again, get aborted. So it will be very bad. So that is why in Malaysia, whenever we know that this particular farm has got brucellosis, and over the times, if the problem not resolved, it's better for us to cull the animal, because it will be waste. Because we know that the disease will be carried for the rest of their life. Brucella animal, how much time? Okay, for Brucella, the infected animal can be a carrier for the lifetime. So that is why we always advise the client to cull, and that is why the government of Malaysia introduced the compensation scheme, because there is no way to treat this disease.
Yeah, it is also same regulation in Indonesia, doctor.
Oh, right. Okay.
Yes, as in slaughter.
Okay. Then I think I answered this already. Not present in cat. I think because cat lacks of erythritol, so they don't like it. And how much Brucella economic loss in Malaysia? In goat is about 8 million ringgit. In cattle, it's about around 2 million. But the figures is just estimation. I think it could be higher than that. Okay, I think that's all for the answer for the question.
Yeah, I think there is no more questions. So, okay, Yes, Prof.
Actually, there's one vaccine. There's one question here: is the current SARS coronavirus 2 vaccine useful for preventing infection, COVID-19 infection? Okay, I think
Okay, Prof.
I think this one, for this one, I think the current vaccine actually protecting the infection of COVID-19. And then I think to stop the COVID-19 infection now, we have to about more than 60% of our population need to be vaccinated so that we can have the herd immunity, and then so our activity will back to normal.
Yes. Yes.
But this one depends on the type of vaccine lah. Like I mentioned before, if kill vaccine like Sinovac, maybe the protection level is lower compared to mRNA and the other one like mRNA and the one is vector vaccine.
Okay. So let me check.
Yeah.
Okay. Yes, I think all the questions have been answered. Yeah, so I think there is no more question, yeah?
Okay.
Okay, for all the students, if you have questions, we still have time, so you can ask directly to the speakers. Okay, maybe they're shy. Or because your presentation already very clear presentation, so there is no questions. There is no more questions.
Dr. N,
Yes.
I'm going to give my new slides for that because some of the slide I didn't present in my presentation just now because not enough time.
Okay.
So I'm going to give you new slides lah. Okay?
Yes. Okay, Prof.
Important coronaviruses in animal actually I already covered in my presentation just now.
Okay. So I'll pass it to all the students.
Okay.
Okay, so because there is no more questions, so I will end this presentation sessions. Oh, Prof, we have one question just now, but this question is for Dr. Intan. Yeah, Dr. Intan, this is new questions from Amir. He asked that Clostridium prevalence is present in Malaysia, and is it cause losses in caprins?
I think so. Yeah, that's why I said we do not know the current prevalence of Clostridium perfringens. But I guess if it's present in the gut of the caprines, obviously it can cause lesion to it. Yeah, but what losses I don't know exactly because we are lack of the studies.
Okay, Dr. Amin, I hope this answer your questions. Okay, let me end this session. So finally, from today's lecture, let me try to summarize or recapitulate the message from our two distinguished speakers. So from Associate Professor Maizan, from her lecture, she has explained the importance of coronaviruses, which are a large family of viruses that cause respiratory, gastrointestinal, and central nervous system diseases in animal and humans that cause symptoms from mild to severe symptoms. And also, he has explained about the diversity of coronaviruses. And the most interesting is the zoonotic coronaviruses. So how do the zoonotic coronaviruses emerge are by mutation and recombinations. And here are also explained that the mutation and recombination that occur on spike 1 protein can alter host range and tissue tropism, and this causes jumping species. And if jumping from animals to human, this causes zoonotic virus. And the second note from Professor Maizan lecture is the interspecies transmission. between different animal species, especially in the emergence of zoonotic virus of the public health concern, have been facilitated by the increased intrusion of humans into wildlife habitats and overcrowding of different wildlife species in wet market and farm. And for the future perspective, more research on development of effective vaccine and antivirals are needed to prevent and control the human coronaviruses. And then from Dr. Intan, she has explained the most bacterial disease in animals and the economic impact of bacterial disease in animals, such as production losses, cost of treatment and preventions, and also worldwide distribution and welfare. And the most important things are that I have noticed here is our responsibility as veterinarians, who plays an important role in preventing the disease to animal and human, as well as preventing economic losses to the country. Okay, so that's all for the for the presentation session. Once again, thank you very much to Professor Maizan and Dr. Intan for the insightful presentations. I'm really sure that all the participants are very satisfied because all the questions have been answered. And once again, thank you very much for accepting our invitations. And we do hope that someday, when the station is safe, we would like to invite both of you to come to our faculty and give a lecture
with us.
So it will be our great pleasure.
Thank you.
Okay, thank you.
Yeah, thank you very much. Now I will return the event to the MC, Dr. Ati.
Okay, thank you so much, Dr. Juliana, for getting this session. And thank you very much for the speaker for informative and insightful presentation. So now we come the next agenda, which is certificate awarding that will be given by Dr. Wiwi Tiasningsih, Doctor of Veterinary Medicine, Master of Health. Please welcome to Dr. Wiwi Tiasningsih, DVM Master of Health. The screen is yours.
Okay. On behalf of Faculty of Veterinary Medicine, Universitas Airlangga, I would like to hand over the certificate of appreciation to our distinguished speakers virtually. Our first certificate will be handed over to Professor Madya Dr. Maisan binti Muhammad, Associate Professor at Paraclinical Department, Fakulti Perubatan Veteriner, University Malaysia, Kelantan. Please, Prof. The second certificate to Dr. Nur Aina binti Kamaruzaman, Senior Lecturer at Paraclinical Department, Fakulti Perubatan Veteriner, University Malaysia, Kelantan. Please, Dr. Intan.
Thank you very much. Thank you very much for the invitation. Happy to be here.
You're welcome. And again, I would like to thank to our speakers for sharing the knowledge. I hope we can see you on another event. Thank you. Back to MC, Dr. Ate.
Thank you, Dr. Wiwi. And before we close this insightful event, kindly remind to all of participants, you can activate your video or camera feature because right now we will conduct a photo session together. Please turn on your camera.
Okay, 1, 2, 3. Wait. Yeah, enough.
Okay, thank you very much. And finally, we get to the last session in this event that is closing. On behalf of the committee, we would like to thanks to all the speakers for the informative and interesting presentation and all participants for the participation. May that we have conducted today will be useful for all of us. Once again, if there are any imperfection during the implementation of this event, we would like to apologize to everyone. Let's close this event by saying Hamdalah. Alhamdulillah.
Alhamdulillahirrabbilalamin.
Hopefully, we can meet again in another insightful event. Stay healthy and stay happy, everyone. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, everyone. Thank you for all the students, all the participants, Dr.
Thank you
Amir,
for the
Dr.
invitation, all this.
Saiful.
Okay.
Thank you, Prof. Maizan. Thank you, Dr.
Sama-sama.
Intan.
Thank you all.
Thank you.
Okay.
More impressive.
Meet you again.
Presentation. More impressive symposium.
Yeah, it was a very good presentation. Yeah, congratulations, Anna,
Thank you,
Ratia,
Dr.
and Prof.
Amir,
Vivi.
for actively asking the questions.